Thank you, Jennifer. Good afternoon, everybody on the call and to our constituency. I'm Cassandra Ganda, Mayor Pro Tem for the City of Las Cruces. I will be facilitating this meeting. Our mayor is on a special call with President-elect Biden, and he'll be joining us shortly. It's Monday, November 23rd. It's approximately 1:02 p.m. And before we recite the pledge, I would like to give my deep condolences to my friend and colleague, the Rosaleses. They lost their father last week, late last week, Mr. Fred Opalaca, Senior Chief Petty Officer E8, who served in World War II. And to extend my gratitude and thanks to all our veterans in our armed forces near and far, and also to give my thanks to our first responders. With that, will you please stand and join me in reciting the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, and liberty for justice and all. Okay, Jennifer, Pet of the Week.
Okay, good afternoon, Mayor Pro Tem and members of council. I am Jennifer Martinez, and I'm with the city's communications office. Let me see if I can share my screen with you. Okay, are you able to see it right now?
Here we go. Yes, Jennifer.
Perfect. Okay. I would like you to meet Dunks, a drooling ball of energy. This one he has an enthusiastic personality, and Dunks is always excited to make new friends. Dunks loves to eat and suggests that he do so alone so he can chow down in peace. So if you're looking for a pal that likes hanging out and has an appetite, that is him. And then we have Linus. Linus is a young kitty. Let me see if I can get this to advance here. There we go. Linus is a very young kitty with a happy, rough and tumble personality, and he loves to receive attention. A family that is youthful and energetic would be perfect for Linus. And let's talk about adoptions. If you're looking to adopt either of those two or any other animals at the Animal Service Center, you can go to ascmv.org/adoptions. The adoption cost is $25. Go ahead and look for their animal number and then call to make an appointment so that you can go visit with your new pet. The number to call is 382-0018. Right now, off-site adoption events are canceled until further notice. If you're interested in volunteering with the Animal Service Center, the Animal Service Center is always looking for volunteers to help with dog walking, cat caretaking, adoption events, outreach programs, photography assistance, foster animals, and so much more. You can contact the volunteer coordinator to find out how you can get involved, and it's that same phone number, 382-0018. And again, the communications office also reminds you about COVID-19. We have a testing surge that is continuing. It's the New Mexico Department of Health that is partnering with a federal agency to do some extra testing around the state. So if you're interested in getting testing, you can go to the normal channels that have been available since March, April, and then now this new one has started November 5th, and it's going to through at least Friday of this week, not to include Thanksgiving Day Thursday. You can pre-register at doineedacovid19test.com, and the times that are available are between 2 and 6 p.m. So that's today through Friday minus Thursday. Go ahead and go online to register from 2 to 6 p.m. It's on the NMSU campus. If you're familiar with Lot 100, that is where you will go. And we appreciate if you do get tested, because there is a lot of cases that are popping up right now, and just to make sure that you're educated and stay safe and help prevent it from spreading to others. Thank you so much, Mayor Pro Tem.
Thank you, Jennifer. Much appreciated. And I just want to encourage you all out there to cruise the website at the Animal Services Center. There's a lot of beautiful, wonderful furry animals, and consider volunteering. Next on our agenda is Jobs of the Week, and I think we have Cindy Quillen. Cindy, are you on? I didn't see you initially.
Hello, everyone. I'm here.
Hi, Cindy.
Hi. Okay, so we're on. Okay, good to see everybody. Thank you, everyone. Mayor, let me see where we're at. Okay, so for today's jobs of the week, okay, so we have the Economic Development Coordinator that's with the City of Las Cruces, and this position closes on December the 8th. We also have contact tracers through the New Mexico Department of Health, and these are multiple positions that are available. We have a front office receptionist for the cancer department and the radiation oncology departments. They are at the Memorial Medical Center. These positions close on December the 17th. We also have a room service operator, which is with the Food and Nutrition Department at Memorial Medical Center. This position also closes on December the 17th. We also have a storeroom clerk with the Materials Management Department at the Mountain View Regional Medical Center. This closes December 19th. And there is also a front office receptionist with the ortho department at the Mountain View Regional Medical Center, and it also closes December the 19th. And for a full list of the jobs and internships and volunteer opportunities that we have with the New Mexico Workforce Connections, you can visit us at www.employnewmexico.com. And we also have www.governmentjobs.com with careers and /Las Cruces, and the contact tracing. This is at www.spo.state.nm.us. And for our New Mexico Workforce Connections information, our contact information here at our Alameda office, our phone number is 575-524-6250. And that address is at 226 South Alameda Boulevard, Las Cruces, New Mexico, 88005. And the webpage, you can visit us at www.employnewmexico.com/. Thank you, everyone. I hope you all have a wonderful week.
Thank you so much. Cindy, I have a question.
Yes.
Do you have any data that supports how, if folks are engaging in this particular jobs of the week actually from our website, and then getting a job actually with the jobs that you put forth?
So what I can do is we do have a contact which is for our All Hands New Mexico, and I can reach out to her and see if she can give us any kind of data or feedback, or I can ask Darlene to see what information that we can provide you with to see if we've had anyone come up and ask for these positions, regarding these positions, or have applied for these positions since we've started doing this. Yes, absolutely.
That would be great, Cindy. Thank you so much.
You're very welcome.
Have a happy Thanksgiving, and please.
Thank you. You do the same. Please keep safe.
Okay. On to our agenda item 3.1, mobile integration health. It's our work session number 20-046. Chief Enriquez?
Good afternoon, Mayor Pro Tem and Council. Eric Enriquez, Fire Chief, City of Las Cruces. It's an honor and a pleasure to present to you today our updates on our mobile integrated health program. It was about 3 years ago that we approached Council with an idea of this concept to be proactive and to help individuals that were frequent callers and high utilizers of the 911 system. Today, we're here to share the presentation of the accomplishments and results that have taken place since then. This program could not have been done without the teamwork of LCFD and the partnerships in the community, but especially Paul Ford, who's been the boots on the ground, and he'll be delivering this presentation in a few minutes. I just want to say that we also want to introduce some next steps as taking this concept to high utilizers of mental and behavioral calls. And this will take the teamwork of Las Cruces Police Department, a licensed clinical social worker, and the Las Cruces Fire Department. We've already established an RFP for this concept, And we've also included, and he should be on the call today, and we thank him, Dr. Ivan De La Rosa, with the NMSU Social Worker Department to be a subject matter expert. Also on the call, we'll have Las Cruces Police Department and other members of the fire department so that we can answer any questions or if there's any further discussion at the end of the presentation. So without further ado, I'd like to introduce, it's my honor and privilege to introduce our MIH coordinator, Paul Ford. Thank you.
Thank you, Chief. Give me just a moment to determine how I'm going to share this screen here. Right. Okay, can everybody see my screen okay?
Yes, I can see it.
All right. Well, Mayor Pro Tem, ladies and gentlemen of the council, as Chief said, my name is Paul Ford. I'm the Mobile Integrated Healthcare Coordinator for the Las Cruces Fire Department. So we're going to talk a little bit about mobile integrated healthcare and what it is, and the type of things that we're doing out there in the community to facilitate good outcomes and where we're going in the future. So why did we create this? Well, mobile integrated healthcare is best described and answering that question with our purpose statement. And that's that we're providing referrals, visitations, and treatment services to high utilizers of the 911 system. And it's for community members with limited access to health and social services to be able to access appropriate health and social resources and reduce that use of 911 system. And then what is our promise to the community in doing this? And that's that we're committed to this program and that we will constantly strive in identifying those who have unmet needs as displayed through recurring 911 utilization. And we'll work very hard to assure that individuals, primarily elderly individuals in our community, will be given help to reduce gaps in their health care. So how are we going to do that? Well, every day we identify at-risk populations and we go and visit them and we bring health and human resources to those individuals in their home. And we focus very highly on those underserved populations that utilize 911 to obtain services that can best be obtained elsewhere. We identify the barriers in their needs and we direct them to resources that exist in Las Cruces to improve quality of life and prevent recurring 911 usage and hospitalization. And we've developed partnerships with stakeholders in the community in order to ensure that we're bringing the right care to the right client at the right time. So this slide is one of the most important slides, and so I'll go into detail explaining what is really happening out there in the community and how it affects the type of referrals and clients that we're seeing. So first and foremost, the number one type of referral we get is for seniors with mobility issues who have some form of Medicare plan for their health insurance. We've done such a good job as a nation battling diseases such as cancer, stroke, and heart attacks that seniors get to the age that they can no longer walk, get in and out of bed, get off and on the toilet, cook and prepare meals. These are called activities of daily living, and at any given time, there are a number of seniors in our community that have significant difficulties achieving these. These seniors are all on Medicare, and Medicare does not cover caregiver services in the home. Caregivers are very expensive. The seniors now need someone there all the time, but cannot afford it, so it's not going to happen. Medicare forces these seniors into nursing homes, but the seniors, they don't want to give up their independence, and as a result, these seniors stay at home and they rely on the fire department to come and pick them up off the floor, get them out of bed, and get them to and from the bathroom. These seniors usually become septic from a urinary tract infection and wind up in the ICU at $10,000 a day. Once the hospital has addressed this sepsis, they're they're offered to go to skilled nursing for physical therapy to try to get their strength up to be able to do the things that they need to in the home. Some agree and go to a skilled nursing facility for 20 days, which is covered by their insurance, and others refuse and go back home. Either way, when the 20 days are up, if they've not improved enough, the skilled nursing facility will offer them to go to a nursing home, and while the staff there is trying to transfer them to institutional Medicaid and collect the financial documentation to determine how all that's going to be paid for, they will have to come up with a $100, $180 a day copay. The senior will then refuse and go back home. And unfortunately, this cycle continues, and this phenomenon is responsible for the spending of millions of preventable healthcare dollars across the nation every year. The other type of client that we see is disabled, low income, and on Medicaid. These individuals always seem to be in their late 50s and have a complicated combination of mobility issues coupled with substance abuse or a behavioral component that has become unmanageable. These people do have personal caregivers, but the managed care organizations in the state that oversee these Medicaid contracts cap the amount of hours their members are entitled to at 40 hours a week. For some of our most disabled clients, that's nowhere near the amount of hours that they need, so they call us to assist with their activities of daily living when the caregiver isn't there. These clients are privy to the same rules as the senior population. They can refuse any care at any time. All these clients are appropriate for nursing home placement, but they refuse and call 911 sometimes 3 or more times a day. There is no simple pathway to place these patients or increase the amount of hours they have. I have tried both. The population is very resistant to change because of some of these components, behavioral health factors, alcoholism, and drug use. And these are the highest utilizers of 911 of the two groups, and also the most vulnerable to poor health outcomes and untimely death. So that's reflected by the major issues that we see with the clients that we normally engage with. So seniors at home with care gaps is roughly 87%, that couples 87% of the types of referrals that we get. Now, of those people, mobility is their major issue, but also, interestingly enough, a lot of individuals have challenges with transportation. 66% of our referrals have a challenge with transportation. And then we have untimely or unsafe discharges account for 36% of the type of referrals that we get. And of course, COVID has made that more challenging. So why does the fire department involved in doing case management in the field in this type of social work setting? Well, first and foremost, the community has this inherent trust of the fire department, and they allow us into their homes, they confide in us, they talk with us, and we've developed this trust, not just us, but the fire department community across the nation for hundreds of years. And so these individuals confide in us. The other important factor of that is because of the amount of 911 calls and the amount of people that access healthcare through the 911 system, we've become a very widespread healthcare stakeholder in the community. So all of these things allow us to provide advocacy and assistance in navigation for individuals that might not be accessing healthcare services or visiting with people in their home for other healthcare stakeholders in the community. And that's very important to us. We want to utilize that niche that we have to provide that service to the community. And so that's the reason why we have this program. So we also are very proud of a lot of accomplishments that we have had. Specifically, the first one would be New Mexico State University has a School of Social Work. And we have worked to develop a memorandum of understanding for second-year master's degree social work students to deploy with MIH as part of their internship. We're able to do this because we have weekly roundtable meetings with a certified social worker to review cases and provide guidance to the interns. And this was approved by City Legal for fall semester of 2018. And we're very proud of our social workers. These are the social workers that that we had as interns last year. The social worker on the left is Charlene Debus, and the social worker on the right is Jack Turney. Jack Turney's gone on to do another internship, and Charlene is now an MSW that is working in the field, in the area that she was interested in. And so we're very proud of that, and we're very happy to be providing that, this unique environment for these interns. The second accomplishment that is Memorial Medical Center's Family Practice Physician Residency Program. And we developed a memorandum of understanding for resident physicians to deploy with our mobile integrated healthcare program. They have the ability to not only write prescriptions and do all of their normal physician-related duties, but more importantly, this is a very unique setting for physicians to actually see the environment that patients are in, the challenges that they have with accessing care and facilitating their own good health outcomes. And so we feel, and so does MMC Family Medicine Center, that this is a very important area of their training that they get. And this was also approved by City Legal in April of 2018. And it is a lot of physicians. These are some of the physicians that have gone out and worked with me in the field over the past year and a half. We think it's a wonderful partnership. We think it's a symbiotic relationship. It obviously helps us. It's a very unique experience for the physicians, and so we're very happy with this program as well. So earlier I talked about transportation, and yes, 66% of the people that we see have a problem with transportation. So we now have a mobile integrated healthcare transport van that we secured through the moving of funds. This program ensures that disabled clients can safely access the services that they need in the community at the time that they need them. This is the van. You've probably seen it driving around. It has a wheelchair ramp in the back. It can hold a lot of equipment. It's definitely carrying around a lot of cleaning supplies and food packages right now. And we're very happy to have this as an added tool in our toolbox to be able to provide services to the community. And we're also very excited about our developing opioid overdose response team. So we were awarded a grant from CARA for $500,000 for overdose outreach over the next 3 years. We are going to use these funds to hire a social worker and develop a response model for an overdose response team. So what we are going to do is that for every overdose that happens inside the city of Las Cruces, we are going to go out and meet that individual and the family where they are at and offer them services to hopefully facilitate a good outcome for that individual regarding their challenges with addiction. And there are usually a myriad of things on top of just Narcan and medication-assisted treatment. We're going to offer both of those things to those individuals, but through our years of doing this type of work, and this is a very similar to the type of model that we do with our case management model, but it's going to function independently, we anticipate that we are going to identify food vulnerabilities, housing challenges, people that need primary care, and people that need behavioral health provider. So we're going to use that as an opportunity to navigate these individuals toward those services as well. So we also wanted to take some time to talk about the outputs, demands, and efficiencies that we accomplished in 2019. So in 2019, we went out to somebody's home or place where they were at and met them where they were at and provided services 554 times. And then that next bullet, client resource interventions, has to do with any time that I or one of the other MIH paramedics makes a phone call to a healthcare stakeholder, facilitates an appointment, takes somebody to the doctor's office, calls and enrolls somebody in a service, anytime that we do anything for that individual, that is a client resource intervention, and then it is logged in our system, and we did that 1,080 times last year. The demands, the number of third-party referrals that we had, and a third-party referral would be anytime that somebody calls us or generates a referral for us to assist with somebody that it wasn't a referral that came from a fire crew on an engine or an internal referral with the fire department. So 70 out of the 134 referrals that we got last year were third-party referrals. And that number is growing as the community becomes more aware of the services that we are providing the community. And then we also, we identify people that call 911 frequently, and we target that population to provide services as well. And there were 33 different individuals that utilized 911 a high level last year. So the results, some results that we take a look at is we want to ensure that 90% of our MIH participants reduce their use of the 911 system. And in 2019, 28 out of the 30 graduates had a reduction in acute care utilization. So this is 93.3%. The second bullet down is that we want to ensure that 75% of our participants have a primary care provider. And in 2019, 29 out of 30 of the participants that we work with had primary care. So that's also a very high percentage. And then the third bullet there is we want to make sure that our MIH participants have some sort of alternative transportation to their healthcare provider. And we had that marked very high at 75%. And that's very challenging in the community. But through our secure of our mobile integrated healthcare van that we have, we're able to ensure that we can provide reliable transportation and make sure our clients can make their appointments 100% of the time. So those are all we're very proud of all of those numbers that we've been able to achieve. I wanted to take some time also to talk about COVID, because a lot of what's happening in the community with COVID comes across my desk, and my team ends up going out there to provide services to the community in these types of situations. So from March through May of 2020, the Mobile Integrated Healthcare Program assisted City of Las Cruces senior programs with case management of their high-risk seniors after the senior centers and their infield case management program was shut down due to quarantine. So we upstaffed with MIH paramedics to provide case management for 43 high-risk seniors. And we discovered a huge need for food and prescription delivery, as well as checking on their welfare in person or over the phone. In fact, the number of home visits we were providing increased by 340% by the time we were in the month of April during the pandemic. We provided comprehensive needs assessments, ongoing in-field case management, and we adhered to evolving infection control policies and procedures. We provided transportation to and from doctors' offices, and we coordinated with food and supply delivery to include toiletries, food, prescriptions, and those welfare checks that we were doing. We have stabilized a tad since the start of it all, but it's very important to understand that we are still double the amount of home visits that we normally go on, and the number of referrals that we are getting is still higher than normal. We are averaging 4 referrals a day right now. So what are some of those challenges that we see in our program? So the external challenges that we have limited control over are very important to recognize. So you heard me talk earlier that Medicare does not cover personal caregiver services in the home. That is a huge barrier for the senior population. The pathway for long-term care or nursing home care requires an admitting diagnosis. You know, the patient has to go through this convoluted pathway that I talked about a little bit before, and that's very challenging because if we identify somebody that needs to go to a nursing home, but they don't have an admitting diagnosis to get into the hospital, that can be very challenging to overcome that. And then obviously, substance abuse and mental illness creates a lot of client ambivalence towards change that we have to overcome. And citizens can refuse any level of health care at any time, which is incredibly complicated for us and creates a lot of challenges. So we wanted to make sure that we touched upon the fact that this is very much a community problem. I pulled this quote from the Wall Street Journal in February, and it really puts the stamp on the senior healthcare crisis that we're facing. It specifically says, healthcare is faced with individuals who clearly can't manage themselves in their own homes, but absolutely refuse to go to assisted living facilities or nursing homes. The key to reducing self-neglect cases is providing services to enable seniors to remain in their homes safely, such as reliable transportation for medical appointments and grocery shopping, as well as affordable home help with chores and regular monitoring. So, yes, I've been saying this for a very long time, but it's very sobering when it then pops up that it's in the Wall Street Journal and that this is a national problem. It's not necessarily just a City of Las Cruces problem or a Las Cruces Fire Department problem. So what are some of the next steps that we're looking at in the future? Because in mobile integrated healthcare in the fire department, we're always trying to forge that next step to see what we can do to help the community. So we want to combine our mobile integrated healthcare program and the concept surrounding that program with a mobile crisis intervention team. And we want to utilize this model that we've developed that has been very successful in the community and curtail it for mental and behavioral calls. We want to improve the crisis response system, and we are hoping to, by doing this, reduce arrests or use of force incidents. And we want to very much create a curtailed and trained response to behavioral health crisis calls. Sending the right people with the right training to the right individual at the right time is how you facilitate a good health outcome. And that's what we want to do, and we want to now do that in mobile crisis and for the behavioral health community. And we're also hoping that in doing so, this will reduce the number of crisis intervention team police responses. So a little bit about the Las Cruces Police Department's Crisis Intervention Team unit. It is composed of 6 uniformed officers who function within their respective shifts, units, or teams as specialists. They are very highly trained in handling calls involving the mentally ill, and they do that every day. And they work in cooperation with all of the mental health care providers and stakeholders in the community to ensure that the most appropriate intervention response occurs. These officers successfully complete advanced crisis intervention training, and some of that training includes behavioral management and crisis intervention, dispute intervention and conflict management, suicide and how to address barricaded subjects, dealing with persons with mental impairments, crisis communication, de-escalation skills, and active listening. The reason that this is all up here is I wanted to make sure that everybody understood that the CIT team is very highly trained, and they have a lot of knowledge, skills, and abilities that they can put towards assisting with this population. These officers follow up on Las Cruces Police Department calls for service that contain some sort of a mental health or mental illness component. And it's very important to understand that this encompasses 1,500 calls for service, and that's over a 3-year average. Those are all crisis intervention team calls. And it is, of those calls, 900 of those result in a protective custody issue where the police officer places the individual in protective custody and takes them to the emergency room. So I think it's important to discuss at this point that We have completed a request for proposal for a 6-month pilot program where we want to create a team that will have one licensed clinical social worker and a contracted psychologist for phone consults. And then we want to pair that with a mobile integrated healthcare trained paramedic firefighter and a crisis intervention trained police officer. So, and it's on this page. I wasn't sure it was going to be here, and specifically a plainclothes police officer, especially when we're looking at the climate of the nation and the community that we currently have right now. How is that going to operate? They're going to respond to 911 behavioral calls within city limits. They're going to identify these high utilizers of the 911 system that have a behavioral component. They're going to allow for referrals from healthcare stakeholders and the community. And they're going to determine the best pathways for patients in the field in an interdisciplinary approach. Now, we think this is important because this is really prevention. We want to do a proactive outreach to those identified high utilizers and prevent an incident from happening. And we want to intervene where a licensed clinical social worker is going to be responding for treatment. And this PowerPoint was actually created in October. This is no longer a draft. This RFP has been approved at this point. Okay, so strategy and results. The other things that we want to do, because we can't just do that without addressing the entire system as a whole, we also want to get all the mental health stakeholders together, and we want to create a community mental coalition to try to get everybody together and to see what we can do as a community to ensure that these individuals have meaningful, appropriate pathways to access care. The other thing that we're looking for is that we want to reduce the number of crisis intervention team calls, and then we're going to document all of the data for this program and revisit this after 6 months. If the 6 months is over and we feel very strongly that this is a good model, we're going to request an extension of time and seek additional funding. So I certainly appreciate all of the time today. I know I talked a lot about a lot of different things that are going on in the community. And at this point, we would like to stand for any questions. And I certainly appreciate the time.
Thank you, Chief Enriquez and Paul. Mr. Ford, are you lieutenant? I don't want to get that incorrect. Sarge?
Firefighter Ford is fine. Paul is fine. Mr. Ford is fine. All of those are fine, ma'am.
Okay, Firefighter Ford. Thank you. Okay, Councilor Vasquez?
Thank you, Mayor Pro Tem. Thank you, Chief Enriquez and Mr. Ford. This is really exciting. I got to admit, I didn't realize the breadth of services that you were offering through this service in the past. And it sounds like people in our community certainly are taking advantage of your services. You know, I know that aging in place is a big deal for a lot of folks. That requires a lot of personal attention, obviously routine medical care, and really the identification of folks who need some extra assistance and how to provide that extra assistance to them, either through a home-based care setting or, you know, rehabilitative kind of therapy and that kind of thing, that sometimes includes that physical impairment or mobility that prevents folks from driving or doing those regular things around the house. So, Mr. Ford, so you mentioned that was the largest, essentially, user group of folks who utilize the services. Is that correct?
Mayor Pro Tem, Councilor Vasquez, that's correct. It's two different types of people that we see more often. The first would be the senior community with mobility issues. It's on Medicare for those challenges. And then the second most prominent would be the disabled individuals on Medicaid that have a behavioral health and a substance abuse component. However, those individuals, when we identify those individuals, they call 911 far more frequently than the other population, but there are not as many of those that we identify.
Totally understood. Thank you, Mr. Ford. Currently, for those Medicare patients that are aging in place and have mobility issues that require your services or assistance, who use the 911 service, is there any type of referrals that you give them to any local options for them to receive that type of care, or is it your understanding that there aren't any at this point?
Mayor Pro Tem Councilor Vasquez, we generate referrals to all of the various healthcare stakeholders that we identify would be most appropriate for that individual at that time. It could be that they need Meals on Wheels. It could be that they need to go to their primary care and get a wheelchair because they don't have one. It could be a variety of things. And over the time that myself and the other paramedics in this program have been working, we know what is available in the community, and we know the pathways to take for these individuals to get the services that they need. There will always be barriers. COVID has created more barriers. One of the large barriers would be if this person needs to be admitted to the hospital, or this person needs to go to a skilled nursing facility for physical therapy, or this person needs a nursing home placement. That would be very complicated right now, but we can still get that individual food. We can still educate them about prescription delivery from small business pharmacies. We can still facilitate a referral to see if we can get a ramp built. We can still bring them a wheelchair and get them to primary care and get home health ordered. We can still do things, but those barriers are changing every day. So yes, I think it's important to recognize that tomorrow, I don't know what's going to happen, but today I have a pretty good idea of what it is that we can and can't do for somebody. That changes every day, and we just do the best that we can with what we have.
Thank you, Mr. Ford. That's really a tremendous service that we have for our population here. And I say that because if we were offering this through a private provider, this same type of response, one is the level of care and sensitivity and understanding of people's personal situations who are Las Cruces residents and not customers of a company, to me, is a different level of attention that I think some of our folks deserve. And so I think I would love to continue to fund this program and to have this program work. The other is, oftentimes when you do work with private contractors, they will, essentially want to refer folks to businesses that are within their business network or have, financial stake in the referrals that they make. And I don't think that's exactly what we're looking for when we're just trying to help people. Not saying that can't be done by a private operator, but I just think, the fire department in Las Cruces has no financial stake or care in where a person receives services or how they receive services. And so I think it's really important to have that independent referral, right? That's not tied to any type of financial monetary gain for an individual or a business. I think that's really important. So thank you for that. And then regarding the folks who may be suffering from mental issues or drug abuse or drug related kind of episodes, what type of referral system is currently available for them? Maybe you could walk me through one of those situations and what typically happens when you encounter that and respond first to one of those situations.
Mayor Pro Tem Councilor Vasquez, it's a very convoluted pathway. When you're behavioral health patients, they access 911 when they have a crisis and they present at the emergency room. If they don't present at the emergency room, they usually present at what is known as an acute behavioral health facility. And that would be a facility like Mesilla Valley, Rio Vista, or the Peak. Those are the major ones in this area. However, in order to intake these patients, oftentimes they need to get medically cleared. And so these patients might knock on the door at one of these acute behavioral health facilities, but they ultimately wind up in the emergency room. And that has to do with liability, and that's some of the challenges. And then we could get into a long conversation about why the crisis triage center would potentially remove that. But let's move past that. So the patient is then in the emergency room. Now, one of the challenges that we have across the nation is psychiatry in the emergency room is very limited. And so a patient might be seen at the emergency room and they have a sore on their leg, or they might have some medical problems, and it might go missed that this individual has significant dementia or psychosis, and they don't meet admitting criteria for the actual medical side of what's going on with them, so then they make their way out the door. There are a lot of individuals that wind up in the emergency room that have a behavioral health disorder, but they go unnoticed, or they go missed, or they don't have an admitting diagnosis for whatever reason. There's a lot of different pathways that can result in them actually walking out the door without receiving services. That's one issue. But let's say that they get identified as being in need of services, and then the case management team will do what's known as a blanket send. And what they will do is they will send to all of the acute behavioral health facilities in the community and see who will accept this patient. And if one of those individuals accepts that patient, then that patient would be transferred by ambulance or maybe some other type of form, but usually by ambulance, to that facility. That individual will then get a 7 to 10 day stay only at that acute behavioral health facility, and that is for the simple reason that that is what's covered by their insurance. Now, for these individuals, 7 to 10 days is not really long enough to facilitate a good outcome with these individuals, and it's certainly not long enough for this individual to just be released without some sort of follow-up. And what usually happens is they're discharged with a referral for a behavioral health provider that they have to facilitate getting to that appointment. They are given some prescriptions for medication at their local pharmacy that they have to facilitate getting over there and picking up. And so they have to do those two things. And if they don't do those two things, then they deteriorate. And one of the other problems, while we're on the topic, is that if these individuals go home, they often feel great because they have been treated for 7 to 10 days. And because they feel great, they don't feel like they have to worry about that appointment. They don't feel like they have to worry about picking up that prescription. And there's nobody that's going to go and pick up those two things and pick up that ball and run with it for those individuals. So those individuals, over time, they deteriorate again, and they wind back up in the emergency room in some way, shape, or form, or the police officer has a run-in with that individual, and then that individual winds up at the emergency room. And so that roundy-roo continues over and over and over again. And it's a major issue, and that is a whole other ball of wax compared to the other two types of patients I was talking about. And I do get patients like that. And they require a tremendous amount of time and energy to facilitate a good health outcome because of all of those things that we talked about.
Thank you, Mr. Ford. And I think that reflects a lot of what we've heard in the past in terms of that continuum of care and how to assure that people are, getting the treatment and the follow-up that they need. I think we have a pretty broken system when it comes to, actually following through on that. I may have missed this, Mr. Ford, but if you get a 911 call for somebody having a medical issue, I'm assuming if that individual is perceived as non-threatening or non-violent or non-threat to their community, does the fire department then respond versus the police department, or how does that get determined in terms of what kind of response an individual gets who is not already at the emergency room or at the hospital?
Mayor Pro Tem, Councilor Vasquez. So when you're specifically talking about a 911 call, when a 911 call comes in, the dispatcher has roughly a minute to make a decision as to what it's going to code the call as and what units they're going to send. Since 2013, the fire department doesn't respond to specifically coded behavioral health calls. And the reason was that at the time, sending 4 firemen in a fire engine wasn't necessarily improving or facilitating a good health outcome for that individual. Now we have we have this whole wing of community health and wellness that we do in the fire department. And as we move forward in the future, we very much want to be involved in those types of calls, and we anticipate that we will be involved in those types of calls in the future. What we want to do is, with that mobile crisis response program that we're going to put together, we want to send that individual or that specific team to that call. That way, we're not necessarily sending an ambulance, and we're not sending 4 firemen in a fire engine. We're sending a very highly skilled team of people that understand how to meet that individual where they're at and navigate them to whatever level of care that we have that is available in the community at that time. It might be, depending upon what's going on, it might be that we take that individual to see a behavioral health provider right then and there. We might take that individual to Mesilla Valley for an assessment. We might take that individual to Peak to enroll them in their partial hospitalization program. We might take that individual to the crisis triage center. I don't know where we're going to take that individual, but I know that that team should be the one that makes the decision as to where we send that person. And we want to get to a point where we don't send that individual to the emergency room anymore. The emergency room is not only very expensive, and these individuals are on state healthcare programs such as Medicare and Medicaid, but it's also a very long-lasting experience for the patient that doesn't yield them the level of care and services that they need for a very long time. And maybe they went to Mesilla Valley to seek services. We plopped them in an ambulance. We took them up to the emergency room. They waited there for 4 hours. And then no acute behavioral health facility accepted them. The hospital determined that they weren't a danger to themselves or others, so they walked out. And they go, well, what happened? I went to this facility, I wanted help, and I didn't get any. And that's because of that pathway that we have. We want to remove that pathway, and we want to make sure that these individuals are having a really good, tailored customer service experience to address their behavioral health needs. And that's the reason why we're doing that program.
Thank you, Mr. Ford. I wholeheartedly believe in this model. And I think when we talk about this type of community response that we all look for people that are in crisis for a variety of different reasons, that this is what it should look like, right? That folks should be met with assistance, with compassion, with resources. I mean, everything, like you said, down to transportation to the actual facility, not just counting on folks to, again, drop them off at the hospital. And as you said, perhaps they get released and not admitted to the type of help that they need. I mean, I envision this type of response being, the solution to so many of the situations that we often encounter that turn deadly or that turn adversarial or where people get hurt in our community. And so I'm very much interested in learning more and figuring out how we can support this. In fact, I mean, this takes the mission. I mean, it takes the fire department, right? Traditionally, but it's more like a community care department. It doesn't sound as cool as the fire department, but really, I think that's what you do. And I think that's what I'd like to see, that I love seeing our department transition into that. Because there is that great need and we are filling that gap. 2 more quick questions, Mr. Ford. One is the RFP that you posted up there, the draft RFP. Could you just comment on that, on what that was for and what the process of that is, where that's at now?
So for Mayor Pro Tem Councilor Vasquez, for the specific question related to the RFP, how we arrived at the RFP and where we're going with the RFP, I'm going to defer that question to Fire Chief Eric Enriquez.
Okay, thank you.
All right, thank you, Paul. Mayor Pro Tem and Councilor Vasquez, thank you. The RFP was developed so that we could get a request for proposal to get that licensed clinical social worker and then also a clinical psychiatrist that can be there for basically like telemedicine. But it's a concept of building a team. And so to go out to the RFP to see who in the community, different healthcare agencies, mental health care agencies that will help us with the scope of work, which we're looking at prevention, intervention, and treatment, and being able to get that in the field by having this mobile crisis intervention team and being able to help the individual as soon as possible. But, you know, as you were saying, it's not traditional for the fire department, but it's also not what police and fire do. We don't do the intervention and the treatment. That has to be a subject matter expert who is licensed, certified, has the ability and has that mental healthcare background. And so we're going to team up with them to help us to assist these people, because we're the ones that get called. We're the ones that go out and respond, and we have to deal with it. And we want to deal with it, as you said, in a very compassionate and caring way to help the individuals, because, you know, everyone has the underlying issues, and we're just trying to help them connect all the dots and give them a quality of life. And so the RFP has already gone through the SAC committee. It's been approved. Will be posted here pretty soon. Unfortunately, you know, like, we do have a holiday this week, so a short week, but it should be out next week to all the healthcare agencies to bid on. And then based on the dollar amount, we will bring that back to City Council if it's over that 75,000 threshold, and see what you all as council are willing to help us out with, and see what we can do with that RFP.
Thank you, Chief. A follow up on that real quick. So the RFP again is that for like a consultant type of role for a mental health care agency to help you design the type or identify the types of resources that you need for this, or is this for a licensed clinical social worker and a psychiatrist to contract with? And if so, what exactly would their job be?
Yeah, basically it would be the contract position.
Okay.
You know, it's thrown out there that even if there's a mental health care provider, such as a clinic that offers all that, then the agency can also look at putting into that with having those individuals. But we're looking for those that have the certifications and the background, the experience, the technical skills, and then we're looking at costs as well and their past performance in this field of work.
Okay, great, thank you. And I don't know if this is a question for you, Chief, or Mr. Ford, but the role of the police, Las Cruces Police Department, in the evolution of this mobile crisis intervention program. Could you just speak a little bit more to that, and what conversations you've had with Interim Chief Dominguez on moving forward on this? Where's the talk a little bit about the synergy there?
Yes, sir. I'll answer that, Councilor Vasquez. We are moving forward. Actually, Sergeant Bob McCord and Paul Ford team up together already on calls that warrant someone who has maybe either a background with violence or mental issues, so that they can work on this together. So we've already been doing that. I've spoken to Interim Chief Dominguez, and we're on board that we're not going to wait for the RFP. We're gonna create a team where one of the police officers that's a CIT trained officer ride with Paul Ford and some of the other MIH paramedics, so that we can start building that team and starting to work together. So yeah, we're moving forward with this as we speak.
Thank you, Chief. And thank you, Mayor Pro Tem. I see my colleagues have some comments and questions, so I will leave it there for now. Thank you.
Thank you, Councilor Vasquez. Much appreciated. Great questions. Next up is Councilor Bencomo.
Thank you, Mayor Pro Tem. Thank you so much, Mr. Ford and Chief Enriquez, not only for the presentation, but for everything you do in our community. I think, Mr. Ford, you've become a household name. People talk about you all the time, and I think it just goes to the level of care that you have for our community and the passion that you do your job. I have a couple questions about the presentation on MIH, and then I do have a couple questions about the larger mobile crisis response model. Also, and thanks to Dr. De La Rosa for being on. You know, I purposely didn't take his research class because students were scared of him. So I just have to say that he's got that good reputation. But as a alumni of the NMSU Social Work Department, it's great to have you on, Dr. De La Rosa. Mr. Ford, out of the 554 folks you served in 2019, would you say, so what I heard you say that the majority of those were 55 and older, is that right? Or what do you think the age breakdown of that is?
Mayor Pro Tem Councilor Bencomo, very rarely is somebody not over the age of 55. Very rarely is somebody not a senior, 65 and over. And that's for a variety of reasons, but I mean, obviously we're very much a senior retirement community. We're very much a senior transplant community where there are seniors that live here and the rest of their family doesn't live here for whatever reason. And this is a very attractive community for seniors with which to come and retire. And when they arrive here, their mobility is good, their health is good, but over time that creates challenges for them. With regard to the other type of client that I see that's on Medicaid, that individual is usually over the age of 55. I don't know why that is, other than the fact that if you have a lot of medical problems and you have substance abuse and behavioral health component, you age much more quickly than somebody that doesn't have those things. That has a lot to do, there's been many articles that are written about poverty and how poverty creates further health problems for individuals because they can't always facilitate a good health outcome. But also they have had a long-standing disability, behavioral health, and substance abuse. So when they get to that age of 55 and over, they are in essence a senior, but they're not a senior on paper. And it's interesting because it creates a lot of problems because I can't give that person Meals on Wheels and other things that they can't get. But the flip side is that they have other things at their disposal. If hopefully they're on Medicaid, they have a caregiver and they have those things. But the short answer is that yes, once in a while I have somebody that is much younger than that, but it is always a behavioral health situation, and they are always on Medicaid or Medicare. Actually, I've never had anybody that was on private insurance. Private insurance is very good at weeding out people that they don't want to cover. And these individuals have a lot of challenges, and so I have never had anybody that was on private insurance. They're always on Medicare or Medicaid.
Yeah, thanks for that. That actually leads to my next question, in terms of economic status, right? And wondering if most of the folks you're seeing are in fact low-income individuals, low-income families. But I think you just answered that. I also wonder if there's patterns in terms of like geographic areas in the city of where you're sort of seeing people and clients. Recently, I was introduced by a fellow social worker, actually, to this really great website, Economic Innovation Group, and they have this distressed communities index, where really they break it down by zip code in terms of how distressed these neighborhoods are in our community, in terms of, and they look at several factors, right, in terms of poverty rate, high school diploma, adults not working, housing insecurity, right, like several things. And I'd be curious to know from you if you see somewhat of a pattern in where you're finding folks and where they live in the city.
Mayor Pro Tem Councilor Bencomo, yes, there absolutely is an MIH Bermuda Triangle, for lack of a better term. It is in various areas. I would be very happy to discuss with the chief how we would go about getting you a map so you can see where the disparities are in the community. But yes, there are certain areas in Las Cruces, and it is very much tied to income and specifically housing, because low-income housing is going to create areas where there are more individuals that have challenges related to poverty and poor health outcomes.
Yeah, I would definitely love to see that map of disparities. I think probably all of my colleagues, I know I sit on the housing and transportation PRCs, and I think those would be critical for us to discuss in those PRCs and probably all the other PRCs. This is so holistic what you do that I think it just crosses all kinds of policy decisions that we need to be making for sure. So I would love to see that map. I'm curious about your timeline to hire your MI. So your social worker that you want to hire is in addition to the social worker for the RFP, right?
Mayor Pro Tem, Councilor Bencomo, yes. So we have our opiate overdose outreach program. We are actively in the process of hiring a case manager / social worker for that program. And then for the mobile crisis response program, we would also want a licensed clinical social worker for that and a prescribing psychologist. So these are 3 different programs. The first program is our mobile integrated healthcare intensive case management program that we currently work on. Then there is the opioid overdose response program that we are developing and we are going to implement in January. And then there is going to be the mobile integrated mobile crisis response team that we are going to look at implementing in the future. And that is going to be yet another licensed clinical social worker.
Okay, great. Thank you for clarifying that. On the overdose response team, who will make up that team? So this particular social worker, you perhaps?
Mayor Pro Tem Councilor Bencomo. So we are definitely going to have somebody that we hire who is going to be a licensed social worker or has that type of training. And we are going to ensure that they have a very high level of overdose related training that is going to be provided us through the Department of Health. We're going to seek further training through Santa Fe, through our CARE grant. And then on top of that, we are going to earmark and identify a firefighter in the city of Las Cruces, and we are going to make sure that they have all of the training that they have. I can't say right now, because it's still fairly early in the process, whether or not it's going to be somebody that already has a high level of mobile integrated healthcare training, or whether or not it's going to be a paramedic. But one of the reasons why we need that is for the level of security and also the level of trust that the fire department brings to the team in order to provide that type of outreach.
Yeah, definitely. I think that's really important that you all understand that, right? Like what role you play in the community and how people see you all, for sure. Thank you for that. I'm wondering if there's anybody on from LCPD to talk about the crisis intervention teams. I'd like to understand more about their training and what their training, Mr. Ford, you mentioned that they have significant training in some of these things. And so I wonder what that looks like and just how significant it is.
Good afternoon, everybody. Interim Chief Miguel Dominguez for the record. Mayor, Councilor Bencomo, I have in my office right now, socially distanced, of course, Sergeant Bob McCord, he'll be able to answer that question for you.
Yes, good afternoon, ma'am.
Thank you.
Just to give you a kind of a background on our crisis intervention program, we started it about 12 years ago. We were actually operating before then, but it was just beefed up about 12 or 13 years ago in 2008. And basically what we did is we have several programs that we put on. There's when you come through the academy, you get state mandated 44 hours of crisis intervention training. We actually do more than that. I think there's an additional 4 hours that we put on of scenario-based training. After about a year and a half, once the officer is out of FTO, we put them through a more advanced 40-hour training, which certifies them. to be a crisis intervention trained officer. And basically, it goes through, as Firefighter Ford explained, a lot of dispute intervention, conflict management, de-escalation skills. Basically, it's communication and active listening skills that they're taught in this 40-hour class. In addition to that, back up just a moment, we have about 91% of the department is crisis intervention trained, where they have that 40-hour CIT training. We have 6 members on the unit that are a part of what we describe as our crisis intervention team. And they're spread out across the shifts, so that the whole plan is, even though with 91% of our department trained in CIT, there's always somebody on the shift who has been through the 40-hour train. And with these 6 additional officers, hopefully the plan is to have somebody who has a little bit more advanced training in CIT, has more interest in dealing with folks in mental crisis. So in addition, what they get is just a little bit more training, just simply because of their interest. They're able to get that more advanced type training. So if something comes open that I can send them to, I'll send them to a more advanced training. Or typically what we've done in the past also is get officers to attend the CIT annual conference. This way we can stay ahead of the trends and stuff that are coming on nationwide. It's always been it's been in our benefit as well. Ma'am, we are the premier agency, in my opinion, in New Mexico, and I know we are in southern New Mexico. We've trained numerous departments throughout southern New Mexico, to include federal agencies as well, and parole probation. So I'm quite proud of those numbers that we've boasted in that. We've also helped, we were instrumental in giving part of our program to other departments like Alamo to get their crisis intervention team started. So that's kind of, in a nutshell, gives you the training that our officers have gone through.
Thank you so much, Sergeant McCord. I appreciate that. And then just to clarify, it's 44 plus some hours, and then after they're done with their probationary period, another 40 a year. And do they have to do that every year, or how does that work? Or is it?
I'm sorry, that's good point you brought up. So the 44 hours is not that they get in the academy is not a certification. It's just a state mandate. So through the Department of Public Safety, they give us a curriculum. We follow that curriculum and implement that training. We typically give an extra 4 hours of scenario-based training for them in the academy. Now, we take the 40-hour is a certification that you basically shows you've attended a CIT course where you get the 40 hours. We do 16 hours of biennial training every 2 years. The state only mandates 2 hours for that, but we do an additional 16 hours. I'm sorry, not an additional, we just do 16 hours. 8 of those are scenario-based. And pretty much the other 8 hours is just to catch up on any trends or new developments that have gone on in crisis intervention.
Thank you.
Yes, ma'am.
Yes. Thank you, Sergeant McCord. I appreciate you jumping on, and thank you, Interim Chief Dominguez, for jumping on as well. I just wanted to understand our internal CAT program a little bit better. In terms of the larger mobile crisis response model, thank you so much for that presentation and for, putting your heads together and coming up with this. I think for some of us on this council, at least I know a couple of my colleagues and I have really been pushing for, at least important for me, a non-law enforcement crisis unit, right? One that is made up of experts, clinicians, people who, it's not a matter of 40 hours and then 16 hours biannually, but this is their entire career, right? This is what they are trained to do at school. This is what they have to do continual education on every single day. So for me, a non-law enforcement unit is critical and crucial. I appreciate, right, I think Mr. Ford talked about a plainclothes officer as part of this unit. I think while that's important, and I think that's critical, even just an example, right? Last year with the asylum seekers, when I was at the triage center working there with the asylum seekers, the sheriffs there, they were wearing regular clothes, and it was an important part of that environment, right? And I think at the end of the day, it's psychological. It's going to impact the way you feel, whether you feel safe or not. And so for me, I'd like to continue pushing for a non-law enforcement crisis unit that shows up in moments of distress. And, Mr. Ford made a great point about we want to keep people out of the emergency room. I would add that we also want to keep people out of jail. We also want to keep people out of the detention center, which for far too long has been used to care for some of these societal problems that we're talking about, right? People in poverty, people with addiction. And so for me, it's really important. And I think over and over, the research shows that those are the most successful programs, both in the outcomes of, people's health and ensuring that people don't end up either emergency room or jail, but also in building community trust and sort of gaining that back. So I just wanted to name those couple of things. I also have a question for, I think Mr. Ford or Chief Enriquez in terms of longevity and sustainability and capacity, right? I think, Mr. Ford, you're probably the busiest person that works for this city. And I wonder what, I'm glad you're bringing somebody else on. I'm really glad that you have social work interns. Man, if this would have been an opportunity while I was getting my master's, I would have jumped on it. But I do, I want to raise the question of like sustainability and what does this look like in the long term for you as a staff that have your limits, right? And so what's your vision for this program? And you posed some of those external challenges, Mr. Ford. I'd like to understand some of the internal challenges.
Mayor Pro Tem, Councilor Bencomo, yes, it is very challenging. Yes, we have limited staff. We are always going to try to push the envelope to expand, especially when we have 4 referrals a day that we're getting right now. I can't go see 4 referrals a day. My counterpart right now, firefighter paramedic Eric Palma, he is a tremendous asset to the fire department. He is currently out there trying to do comprehensive needs assessments on all 4 of these referrals that we got today. But meanwhile, there are other things that are happening while he's doing those referrals. So we will consistently be advocating for expansion in the high-risk case management program that we currently do right now. There will probably want to be expansion in whatever our mobile crisis response program looks like. And we may end up deciding based on the data that we want to continue and expand the opiate overdose outreach. Overdoses are not necessarily going to reduce as COVID continues. There's more trauma, there's more challenges, there's more poverty, there's all sorts of more bad stuff. And so there's going to be more pain and suffering, and there's going to be, and that's going to create more overdoses and more usage, drug usage. So I think there's going to be room for growth in the future for all 3 of these programs. And I'm very sure that at some point in the future that we will be back here discussing the fact that we want 2 or 3 Paul Fords for this, and we want 2 or 3 Paul Fords for that. One of the challenges with that is that we have a lot of different firefighters in the fire department. They're all very good at a variety of different things, and we have to consistently earmark and provide training to those individuals so that we have the right people that is doing this type of work.
Absolutely. Thank you for that. Oh, Chief Enriquez, I saw you reach perhaps to unmute. Did you want to jump in?
Yes, Chief Enriquez again, Mayor Pro Tem and Councilor Bencomo. To add to that, I think in the conversation, whether Councilor Vasquez or yourself talking about being community oriented, you know, one of the things that the fire service is trending towards is community risk reduction, whether it's fires, whether it's EMS, whether it's healthcare, these type of things. And that's where we're headed. And we see that. And we'll need to collect all the data. So we'll constantly collect the data. I can tell you cost-wise, it costs $60 an hour to send Paul Ford and the mobile integrated health van out. 4 firefighters and an apparatus is $252. But the cost to send someone to the hospital, to send someone to the correction facilities, it's a community cost. It's going to entail more meetings and coalitions in order to get those partners in the community to help us sustain this as well. So that's what we'll be looking at doing for the future as well.
Absolutely.
I'm sorry, Mayor Pro Tem and Councilor Bencomo, if I can just add to that, in terms of the research and what we know the effectiveness of these types of model cost effectiveness studies have found that the cost of emergency room visit is saved and even greater by having these types of mobile crisis response team. And the secret sauce is having individualized care plan. These are marginalized, vulnerable population that are falling through the cracks. And these kinds of teams are able to, in an interdisciplinary format, go in and look at each individual case and develop a plan that is, appropriate to that particular individual's needs. So, and that's what we're finding from the research. In the long run, in terms of sustainability, we will save money.
Thank you very much, Dr. De La Rosa. I think that's right on. I mean, all the research I've read about this, right? I think even from the CAHOOTS program in Oregon, they talk about the significant amount of dollars they've saved their city and their police department, right? But also even Judge Arrieta talked about this, about the cost between incarcerating someone and putting someone through something like drug court, right, is significantly cheaper. And it's not just about cost, it's about quality of life, right? I think we all can agree on that as well. I don't know, Chief Dominguez, Interim Chief Dominguez, you might not have this immediately, but I would love to know how many of your calls that police officers actually go out to, the percentage that are related to mental health or addiction. Perhaps you all do know that now, and then, but if not, that's okay. I'd love to, maybe someone can email that to me or to us. The last question I have, because I could talk about this for a really long time as well, Mr. Ford. The last question I have, though, is Chief Enriquez, you mentioned the RFP, and if that came sort of below the 75,000, what else, though, what's the other components of the RFP? Like, who else are we looking for, right? It's not just about cost, what kind of experience and expertise do we want those people to apply to have?
Yes, right now what we have in the RFP, because it is a new concept, but we're looking for those mental health providers that have the license and the certifications. That's what we're looking at having at this point, so that they can help us, and then we'll continue to build on that. The RFP is also being designed that we do a 6-month trial, and then after 6 months, if we see that we need more mental health providers or qualifications or things, at that point we can bring those also to the table. We talked about even being able to get a licensed clinical physician that can also do prescriptions as well, so that way we can get the immediate treatment, any medications and things like that in the field, and be very proactive. So those are some of the things that we're looking at. Again, this is a new concept that we're looking at, and we'll grow and develop from there.
Thank you so much, Chief Enriquez. That's right. I think for me, the last thing I'll say, right, is just really advocating to set up a program that's going to set us up to succeed, right, and not set us up to fail. I think we're trying to take on something really huge, unfortunately, right? Mr. Ford really talked about the disparities in the healthcare system and the mental health care systems. And so as a city, we're trying our best, right, to do what we can. And so I just want to make sure that we set up a program that sets us up to succeed. And so whatever I can do to support that, I will. Thank you very much, Mayor Pro Tem, and thanks everyone.
Mayor Pro Tem and councilors, this is Fire Marshal Cody Haver. If I may have a couple of minutes, would that be okay?
Absolutely.
Okay, thank you. Well, for the record, I am Cody Haver, a battalion chief and also the fire marshal for the City of Las Cruces Fire Department. I am also the battalion chief that manages the Mobile Integrated Healthcare Program and fire prevention. So I have a couple of thoughts, maybe a couple of answers to some questions that have been brought up along the way. The first thing is you had kind of asked about what is our vision, what are we looking for? And the truth is we're really looking at this as growing into a community risk reduction department altogether. Everybody's very familiar with fire prevention, right? Every year we're involved with fire prevention. We do inspections of businesses. We do education and outreach to the community, both adults and kids. We're in the schools. We're in the community a lot. And with that, the point to that is that we want to reduce fire deaths and injuries and destruction of property, right? It's a prevention model. We're just out there trying to prevent these things from happening. We know that there will continue to be some fires, but our response model brings it to the point where most of the time we're able to get to fires quickly enough that we're able to keep that level of destruction and injury down to a minimum. That's exactly what we're trying to do with not only the Mobile Integrated Healthcare Program that we've had for almost 4 years now, but also now looking at what is the rest of the need out in the community. Truthfully, a lot of what we have found has been through Paul's work. One thing that I'll bring up, I'll just touch on just briefly, but I was actually the person that Chief Enriquez chose to begin even researching mobile integrated health and community paramedicine to see if that was even a program we wanted to start in the fire department about 4 years ago. And in that research, I actually went to Colorado Springs Fire Department and I did a ride-along of their mobile crisis response unit for an entire day. And their unit 4 years ago, and it continues to be that way today, and it's been published in peer-reviewed journals multiple times, is a police officer with a social worker and either a paramedic or a nurse. And the team of them have more advanced training together in how to deal with mobile crisis response. One of the questions that you brought up about law enforcement, and I think they're valid questions, but there are definitely things that need to be, understood and talked about along the way is, New Mexico is a state. Colorado is a state. They're different states. Their laws are different. Their regulations are different. The way that they run their healthcare systems and Medicaid systems and those types of things are different. And unfortunately, here in New Mexico, you're all very aware of, the disparities and the issues that we have in the entire state and also here in Las Cruces. And that's one of the problems is that we are at the mercy of some of the infrastructure in what we can or can't do. An example that I can bring into that is, I can remember just 4 years ago being a lieutenant on a fire engine running calls. When mobile crisis then was actually out in the community and seeing many patients, I can remember getting several 911 calls from mobile crisis themselves on scene. And they were advocating for, I've got this patient, I've got this client, we've been here for an hour or two, we've been talking with them and doing an assessment on them. And we feel that they need to go to the hospital and potentially get further treatment. Well, unfortunately, if the person doesn't agree to that, the only option is protective custody. A police officer is the only one that can do protective custody. And I think the important thing to just kind of throw on the table and think about is, obviously the police department's very busy. There's, hundreds of officers out there on the street. And I can remember times when it's just whichever available patrol officer shows up to the scene, and then us as the fire department and the caseworker on scene would have to then for 10 minutes explain, well, the case manager was on scene and they did this assessment, and now the fire department's on scene and our paramedic has done this assessment, and then we would have to explain to the police officer and help justify why they needed to put them in protective custody. And I think that's the key component of having a very specialized CIT trained officer on a team is they know the system, they know the team, they know how mobile crisis works. They're actually part of the mobile crisis and response model, and they have much better information, and they actually get practiced much more in how to deal with those types of situations, rather than relying on the next available patrol officer that may or may not have had many interactions in the past. So that's just one thought to kind of throw out there, generate a little bit of discussion about what part law enforcement might play in mobile crisis response for us. And then, you know, again, I think it's just very important to put on the table that obviously we've had many conversations about the Crisis Triage Center and our mental health systems in general, what's available to our community, what agencies are available to our community. And, you know, as many of you, and I'm sure Sergeant McCord and Paul will all advocate, our community, our city is very distressed right now in the level of infrastructure that we have available. And COVID has just decimated what, you know, the last little bit of what we did have available as a reserve, that is gone. And I think, you know, both chiefs, I'm sure, can advocate to the increase of call volume that we've had over the last several months. So with that being said, we really are trying to work toward, as quickly as possible, getting people on the street, getting more paramedics on the street, getting a case manager, getting social workers, so that we can continue to provide the level of service that we have been doing to the community. Just to answer a little bit of a question about, you know, what resources do we have available to us? Well, in truth, most of the funding to our program through the city is really just in the salary of Mr. Ford. We've relied on, when we have a little bit of salary savings or a little bit of depth in our staffing, we'll maybe temporarily bring somebody over to help. That's actually how the other paramedic has been involved in the last couple of months, is because through COVID, Paul just maxed out. He had nothing left. And as of today, we have a referral list of 30 people deep right now in Paul's, you know, email, waiting for us to see. We're getting, again, like you said, referrals, you know, 4 a day, 7 days a week. And these are complicated patients. These aren't just, you know, let's go over and check them out, do a welfare check, see if they're okay. I mean, these are involved patients that we see for weeks on end. And there are many, many more people in this community that we could see if we have more resources, but we really are limited to what we have right now. And so I think if Chief Enriquez wants to step in as I finish, our vision for this is, again, just like Councilor Vasquez says, really a community care department. The fire department's model has changed so much in the last 15 years, 10 years even, since we've been involved in EMS. You know, over 80% of our calls now really, or just at 80% are EMS calls, medical calls. We are one of the largest healthcare stakeholders in this community now, and we are trying to really step into that role and do what we can to do more for the city and for our community. Chief Enriquez, and thank you for your time.
Thank you so much. Next, I don't know, Chief, do you have something to say further about that?
No, that's good. Thank you.
Okay. Next up is Councilor Flores.
Thank you, Madam Chair, our Mayor Pro Tem. A lot of the questions and areas that have been covered by my colleagues so far have been answered or addressed. But I have a question that is maybe a little bit off topic, but I need to know this. Mr. Ford, and when you've been out to see someone who's in distress, you know, and you're saying you're dealing a lot with senior citizens, and it sounds like most of the calls are for people, if not the majority of the calls are for people who are in the poverty range. But have you been to homes where the person who has made the call is a senior citizen who is not impoverished?
Mayor Pro Tem Councilor Flores, yes, that happens also. Seniors have the same challenges with their mobility and their health and wellness, regardless of what their income level is. And also, when you think about how much it actually costs out of pocket to have a caregiver in the home, it's about $25 an hour. So if you're somebody that needs 24 hours worth of care, you can expect to pay $16,000 a month. So only the most wealthy in this region can actually afford something like that. So that there are going to be people that have funds with which to get a ramp built and get a smoke detector put in and get a new wheelchair and maybe get a caregiver for a certain amount of hours and do some things of that nature. However, they're still going to have some of those challenges because caregivers are very expensive, and not very few people know the pathways with which to facilitate a good health outcome on their own. They don't know about Meals on Wheels. They don't know that Walmart does delivery. They don't know Delray Pharmacy does prescription delivery. They don't know all of these things. And so I will go in there and I will have these conversations with them, and then we'll see what we can get accomplished. I usually have a good outcome with somebody that doesn't necessarily have financial difficulties, just needs to understand what pathways they can take to facilitate a good health outcome.
Okay, and so people who do have, and maybe even have health coverage, like through Medicare, Medicare people who are a certain age qualify for Medicare, and then you get the what's it called, supplemental insurance. So people who feel that they're being taken care of in that regard and therefore don't seek your services may be shortchanging themselves, or would that really, really, really overburden what you're doing? Because it sounds to me as if you're meeting the needs of those who are in urgent care, or not in urgent care, but in an urgent situation to be cared for. And the reason I'm asking this, and this is going to a really weird place, probably really off tangent, I think, but I have to address it publicly. Some of us have been active in looking at cases where seniors, people who are vulnerable, have been taken advantage of by those who are, quote, assigned guardianships. And there's been one that was, heartbreaking, just absolutely heartbreaking. And that was Mrs. Doris Hamilton, who was, she was principal at at a middle school. I think it was Lynn Middle School. I think that the mayor was a student there at the time. I mean, he was there and she was at any rate, there's been a gross violation of, I don't want to call it illegal. I'm not, but anyway, do you zero in on any of that? Has that ever come to your attention? And if you did have any, have you ever had, quote, a guardian, unquote, intervene and try to take over or anything like that? And if you did have a situation like that, would you report it to the DA's office or to police department, or do you?
So,
Paul, can I get you to, as you're answering questions, please remember to state your name, please? Thank you.
my apologies. Mayor Pro Tem, Councilor Flores, this is Paul Ford. Yes, elderly exploitation is quite common. It is more prevalent in the community where there is something to exploit. So yes, it definitely does happen more with seniors that have some financial cushion. We do encounter this. And when we do encounter this, there are a variety of avenues that we take. The Adult Protective Services, I usually generate an Adult Protective Services referral. Adult Protective Services is one of the only entities that can actually investigate cases of exploitation, and they do that on a regular basis. They have a lot of cases surrounding that. There are usually some other things on top of the exploitation, and the exploitation is usually something that I discover after I've been there to address some other issue that's going on. And I have actually been to court before for guardians that I felt that were not taking care of their elderly individuals. So I have actually gone above and beyond in the past. And so I think the answer to your question is yes, this does happen. Yes, we do clue in on it. We're good at identifying exploitation, and that we do generate referrals to address that.
Great, thank you so much, Paul, or Mr. Ford. I want to thank you for everything you do, and as I said, my colleagues, I think Bencomo and Vasquez have pretty much asked you or asked all the questions or addressed issues that also concern me. It affects us all. But I want to thank you in particular because there was one woman that I literally picked up. I mean, she was, and I drove her home, and then I helped her out a little bit. And then I talked to Jamie Rickman about it. And she said, well, you have to call Paul Ford. And then after that, I've learned, and you came along and helped her out, but you have also not just worked here, but you actually schlep out to El Paso, and I think, or outside of the city of Las Cruces at any rate, maybe throughout Doña Ana County, taking people all over the place. So I think it's going to be very, very difficult to find another Paul Ford or two or three that we probably need. And I just want to thank you for everything that you do. I do have a question. On page 17 of the slide presentation.
Real quick, Councilor Flores, I think Chief Dominguez has his hand up and wanted to answer
I'm sorry.
a question, if we could. Chief?
Absolutely. Thank you. Thank you, Mayor Pro Tem.
Mayor Pro Tem and City Councilwoman Flores, this is Sergeant McCord of the Las Cruces Police Department. The reason I put my hand up is I'm very familiar with Miss Hamilton and her family and the trials that she's been going through with her guardian. And I wanted to confirm, ma'am, that she is not alone. There are state statutes in New Mexico which make it so that a guardian can basically put a lien on a person's home. They can seize their accounts or put a lien on their accounts. And unfortunately for the police department, that falls out of our hands because it's a civil matter. In my opinion, they're covered under state statute, which is really sad. And there are guardianships out there that do take advantage. I've encountered it several times over the last 12 years of my involvement with the crisis intervention team. The thing that I did with Mr. Hamilton is I advised him to contact an attorney and file a lawsuit. And actually I spoke to him several months ago. He's in the process of doing that. But that family is not alone. That is.
You're coming in and out. I'm sorry, we can barely hear you coming in and out.
Is this any better?
Yes, it is.
Okay, I'm just wanting to reaffirm that, yeah, this is a problem, and I don't have an answer for it because it does fall under state statutes.
Wow.
But it's aggravating, I can tell you that much. But I did want to chirp in and let you know that, yeah, it's not an uncommon problem.
Thank you. Well, Mr. Ford did say that it was under the auspices of the office of whatever, adult services office or department. But but do you, sir, do you make any referrals, or do you contact adult services, or do you contact the Attorney General's office since this is a state issue directly?
Well, ma'am, I don't, because it falls under state statute. You can do that.
Lieutenant or Sergeant McCord, yes, would you please state your name as you're speaking, okay, please?
My apologies. Again, I'm Sergeant McCord, Mayor Pro Tem, Councilwoman Flores. I do know that Judge Arrieta has been advised here at District Court And that's why I advised Mr. Hamilton to file a lawsuit. And I don't know where he's at with this, but it is a civil matter, and I don't know what else we can do. I think this would fall more towards lawmakers in Santa Fe to change that.
It does.
Yes, we're working on that. Thank you so much, Sergeant McCord. Thank you.
Yeah.
Yeah, and so, Mr. Ford, if I may I go back now? Is this okay, Mayor Pro
Yes, you
Tem?
may, Councilor Flores. Thank you so much.
Thank you. Page 17, you referred to the results, Mr. Ford, July through December 2019. And you know, there was been a reduction in 911 calls. There was 75% of, you know, people have other resources. But my question is, over what period of time were is this the first time you gathered that data or do you have data before then? And when did the mobile integrated healthcare start here in Las Cruces?
Mayor Pro Tem, Councilor Flores, Paul Ford. We've gathered data since we started peak performance. And however, and we've been running the mobile integrated healthcare program for about 4 years now. We started in fall of, that would have been 2016, and we started with just a handful of patients, and then we expanded to have a few more and have a few more. Today, we're looking at about 15 cases right now as of today that we're actually actively looking at right now. The data, we are always looking at ways to gather the data more efficiently. We have a software program called Image Trend that we use to assist us in gathering that data. One of the challenges that we have is that I'm time on task from the time that I walk in the front door here at the fire station until I leave sometime after 5. And so sometimes gathering that data becomes very difficult for me to do on a regular basis. Then I have to play catch up and I have to go back and I have to take a look at all of that data. So the data that we're looking at right here is some of the more recent data that I have. I would be happy to gather up more data in the future. I don't know why my camera is doing that, but because we understand that data is important. And we will continue to do that. But also, some of the things that we're looking at right now are not necessarily in line with what it is that we thought that was important for us to be gathering for data in the first place in the beginning. So, sure, we want to make sure that people are reducing their use of a 911 system. Of course, we're going to try to make sure that everybody has a primary care provider. And of course, we're going to ensure that people are trying to reduce transportation. But we're also looking at other things like how many referrals do we get for people after their house burned down? And who are we working on with that? How many referrals are we getting in hotspotting areas like what Councilor Bencomo was talking about earlier? How many people are coming out of the hospital unsafely? You know, we're looking at that also because that's a big deal. So we're looking at various types of data all the time, and we're trying to determine what data we're going to want to take a look at in the future, how it meshes with peak performance, and what measures we're currently looking at right now, so that we can determine that the data that we're gathering is the best representation of our program and what it is that we're doing in the future.
Thank you, Mr. Ford. I just want to make a comment, and this is generally probably for our city manager and staff, but of course, city manager. And that is a need for economic development in the city. I mean, real economic development, not necessarily limited, of course, to, not that it's not important, but not limited only to franchises or other businesses, but having a real economic base here in the city, because I think that the root of all of this is poverty. I think you addressed it, Mr. Ford, that it has a lot to do with people, you know, not eating well. And the fact that if you don't have that nutrition, you will age faster. If if you have if you have a good education, that means that we need the economic infrastructure to eliminate all of this, and it'll take probably a long time. So in the meantime, I really appreciate everything you do, Paul. I think everything you do is just, I think you've saved a lot of lives. I think you've made a lot of people feel that life is worth living, and you certainly enhance our community insofar as the care that you've extended. So thank you so much, and I hope your baby is going to be a year old now, right? Your little boy?
Mayor Pro Tem, Councilor Flores, Paul Ford. Yes, my son Liam turns 1 on the 26th, so just a couple days from now. And he's walking around and breaking everything and really causing a ruckus, which, as I understand, is normal. So I'm not too worried about it.
Yeah, normal, healthy. So thank you and happy Thanksgiving.
Thank you.
And to the rest of the gentlemen who have spoken, thank you.
Thank you, Councilor Flores. Next up is Councilor Abeta Stubbe.
Thank you, Mayor Pro Tem. Thank you, Chief Enriquez, Dr. De La Rosa, and thank you, Mr. Ford, for this presentation and everything that you've been able to do for our community. As described before, my fellow councilors have asked some really great questions. There are a few items that I wanted to touch back on. In the commentary, it sort of happened. What type of coordination are we able to provide for clients when they need like specialized care that's outside of the city limits? Are we able to work with them? I know in my district, one of the issues that we had was some of our elderly folk that cannot drive, but had to go to El Paso for specialized care, but not having either the funds for it, transportation, and caregivers. So yeah, I'm curious to see if we work with coordination for those types of items too.
Mayor Pro Tem, Councilor Stubbe, this is Paul Ford. That is an excellent question. So one of the challenges that we have is that the fire department is the authority having jurisdiction inside City of Las Cruces city limits. So if I get a referral, I can kind of go wherever I want, go talk to somebody, figure out what it is that we're going to do and all the rest of that stuff and kind of coordinate that care. However, and I know Chief Enriquez is going to want to step in here because he's on the Veterans Board, veterans specifically need to go to El Paso for a variety of things. How are they going to get there? It's been a very big challenge. Also, over the past year, I've had some seniors that end up needing to go to El Paso to receive detached retina surgery and other sort of eye surgery. I guess there's this big eye surgical center in El Paso. How do we facilitate transportation for that? It's not really that big of a deal when somebody is on Medicaid, but as you well know, which I said before, the majority of these seniors are on Medicare. And as Councilor Flores was talking about earlier, that premium plan that you subscribe to is called the Part C plan or the Medicare Advantage plan. The Medicare Advantage plan is really great at making sure that you're not stuck in the Medicare donut hole and paying up the wazoo for certain types of things. And they're really good at making sure that you're not having to pay for a certain amount of prescriptions. But what it's not good at is it doesn't provide transportation. It doesn't provide care coordination for somebody to take over doing the stuff that I'm doing for that individual. And so I don't really have a good answer for you. However, I will tell you how I had done it, trying to make ends meet and facilitate a good health outcome for somebody in the past. So I had somebody that had a detached retina and he was a veteran. And this happened around about when COVID started. So my wheels are already turning, trying to figure out how are we going to meet the needs of the community when I'm just one person and I don't even have any interns right now because the school year hasn't started yet or it's shut down and we don't have interns right now. How am I going to figure this out? So what I ended up doing is there are some volunteers in the community that are really passionate about doing good. And they called me and they said, give us something to do. And I said, absolutely, I will give you something to do. So they started making food packages and they started doing some other things in the community. And they started going and visiting people and making phone calls and making sure that people are okay. And then they started going to Casa de Pellegrinos and picking up food packages for me, which is great because, by the way, I went there last week and it's an hour and a half wait to get a food package over there because the need is so big in this community. We can talk about that some other time. So they're going and picking up food packages. And then I said, okay, well, what else can we do? So then we got in cahoots with the Lions Club and they got a food pantry and they made food bags. And I go and pick up those food bags and I call people to go pick up food bags and take them places for me. So then I can go over to this house and look at this referral instead of delivering the food package to somebody. So we're trying to do everything that we can in the community. And ultimately I had them give this individual a ride to El Paso and then pick them up after he was done with surgery and then take him back home. So we're trying to do everything that we can, but yes, there is a huge need in the community for transportation. Hopefully there won't always will be, but there are people that need services in El Paso because it is a major healthcare hub in the area. And how do we go about doing that? And then I'm sure that Chief Enriquez wants to talk about the veterans and that. So thank you. Thank you very much.
Yes, if I may, Mayor Pro Tem and Councilor Stubbe, Chief Enriquez, that is a dilemma. It is difficult. I know, especially with the COVID, because with the veterans, the disabled veterans care, they have transportation and they are constantly lobbying for additional resources in the state. Not just communities, because you've got a van from Las Cruces and has to transport a veteran from Silver City to El Paso, where they can be admitted to a veterans hospital. Those are some of the issues that even the veterans are facing. So within our city limits, what we try to do is exactly what Paul has stated, is seeking out the volunteers. You know, we had a lot of community involvement during the asylum seekers program and a lot of faith-based organizations that we are still in contact with and have continued to help out with that. Moving forward, as I said, and I've stressed this to the members of LCFD, that this is not a fire problem. This is not a police problem. This is a community problem. So we all have to work together. So again, working with different agencies and groups that have transportations and that availability is what we'll be seeking and building that coalition in the future.
Mayor Pro Tem, this is Ivan de la Rosa. If I can, Councilor Stubbe, the model, the mobile crisis response team model, is to really look at clinical case management, working with community partners, helping patients and clients to navigate those complex systems of care that they may not be aware of. And that's what's unique about this model.
Thank you for that, Dr. De La Rosa, and thank you, Chief and Paul. You know, I'm very familiar, unfortunately, with that ophthalmology center. Our daughter had her surgeries there. Yeah, that's one thing that I know in our community, as we do have an aging population that needs care. Specialists are very hard to come by. Even our, the reimbursement rates are different for doctors and providers here. And so that, poses significant issues. And that's not something we can really affect on the council level. But, it all kind of comes together. When talking about capacity, what on average, how many referrals a day or assessments can be done in a day?
Mayor Pro Tem, Councilor Stubbe, this is Paul Ford. I think it really depends on what's going on with the individual. So I'll give you an example of something that's low acuity. So I might have an elderly citizen that calls me because she wants me to change her smoke detector batteries. Now that sounds really low acuity, but the reality is that's an opportunity for me to be in a home, to see what's going on in there, and to kind of clue in on things that I've over the years been able to clue in on because of my experiences. So I do those, and I may only be there changing like 4 smoke detectors for a little while, but I'm definitely going to take the opportunity to talk about a fire extinguisher. I'm definitely going to take the opportunity to talk about loose cords and do a fall safety assessment, and I'm definitely going to take an opportunity to discuss that, by the way, your house faces to the east, and you have a large shaded area here, and it just snowed yesterday, so there's a lot of ice here in the front, and so you definitely are going to want to probably walk out through the garage, and whenever this happens, I really recommend that you be careful. Now, I don't know whether or not that's ever going to have prevented this lady from having a hip fracture, but I like to think that maybe it did, and I'm going to take the time to do that. Some of these larger ones, I may be there sitting and talking with the individual for a long period of time, just to tease out a little bit of information that I need to kind of figure out what it is that I'm going to do. Other times I might go in there and I'm told to get lost. And so I go to the Sonic and pick up a hamburger. I come back and I give him the hamburger, and maybe he changes his mind about the conversation that we were going to have, because I established that little bit of trust and value to that individual. So what I'm trying to say is that all of these different home visits vary in intensity. Eric's pretty good, time on task. He could probably do 5, maybe 6 home visits in a day. But again, it depends. Am I bringing in an entire truckload of food? Am I stuck at Casa de Pellegrinos picking up a food package? Am I up at the hospital for a little bit trying to follow a case because I was there? The person was really ill. I ended up having to call 911 to get an ambulance, and then I have to go up to the hospital and have a conversation with case management on what's going on with this person. That's a very long, lengthy visit. And so that could take up a large chunk of the day. Emails take up a large chunk of the day, which we're all aware of. Things take up the day. And so it really varies. I think that I can do 4 really long assessments in a day and then go somewhere else and try to actually facilitate some sort of an accomplishment for that individual. And then I have to go back and do all the charting and everything too. So it varies. I would say 4 to 6 would be fair for one person to try to do in a day.
Thank you. And, that's good to know for my reference on thinking of what type of capacity and resources you do need, and how much, if we see the increases, on how many other staff that you might need. So I really thank you for all the work that you've done. I have another question, but it's directed more towards our police, and it's regarding our CIT program as well. And that's what is the measure of success or measurement of success that you have for a call? And what type of data do we track on the program, and any sort of different statistics that you have on successful outcomes with it?
Mayor Pro Tem and City Councilwoman Stubbe, did I get that name right?
Beta Stubbe.
Okay. Sergeant McCord. So I want to make sure I understand the question. As far as tracking, I keep track of all of our numbers of calls that we get. And I've done that, I want to say, for about 6 or 7 years, just to see what our trends are. I would say we haven't seen a lot of increase. Maybe some with the COVID shows this year a little bit of an increase. But as far as the tracking, that's how I keep track of it. I think I would say that our success is rated within the community. I know when we first started 12 years ago, the meetings we would go to, we did not have very high community support. I think if you were to go into the mental health community today, they would basically say, yeah, we've come a long way from the way it was prior to 12 years ago. I know when I go to meetings, I'm greeted by old friends who basically were there when we tried to start the program. So that's how I think our success is really compounded, is not so much by numbers, but just by the support that I've seen in the mental health community over the years.
Okay.
Did that help you and answer your question, ma'am?
Partially. When you attend an event, given the nature that they're going to be so different, every single one, and I'm sure though, at each event you're looking for specific outcomes. And then I'm wondering if you track those types of outcomes that you wanted. And then if it wasn't an outcome that you wanted afterwards, what type of debrief is there, or documentation that you do to look at it and to, move forward with perhaps different practices or anything like that?
Well, major incidences, we would not be able to on a daily basis debrief every incident involving mental health that we go to. When we have major incidences, we will do debriefs. That's part of the unit that I do with the crisis intervention, as well as with the hostage negotiation unit. So basically, we will sit down, we'll do debriefs, see what we could do, to learn in the future. But it's pretty much by major incidences, because that's a daily thing for us to go to crisis calls. We not had a lot of success in trying to keep track of de-escalations, but the truth is, from the classes and of de-escalations that I've gone to, just about every incident is a de-escalation, because you're out there with somebody who's either in crisis or not happy, even if it's just a domestic or a simple neighbor dispute. It's a de-escalation. You've gone out, you've thwarted the crisis from taking place by either talking the neighbor down, making somebody happy. So it's almost every call we go to is really a de-escalation or an attempt to de-escalate. I mean, we go to calls where there's disputes, and that's what we do, de-escalate the dispute.
Thank you. And then when looking at this other programming that we're talking about here, I would imagine that we would want to keep pretty good data on our events and how we're looking into this program, just to make sure that it's working and that it's been effective. And I'm not sure what types of data that you all were thinking about tracking with this new program, to make sure that after the 6 months that we can say, yes, this was an effective program, and this is why.
Mayor Pro Tem and Councilwoman Stubbe, Sergeant McCordigan, basically we keep track of our numbers through the years. What I would like to see happen is, when we're responding with the fire department for this program, what I'd like to see is a decrease of the numbers that we've averaged over the last 3 years. And I think that's going to be the goal of the unit for the police department as well. And so that at this point, once we get started, that would be my goal, is to see after 6 months if we've seen a trend of our protective custody issues decrease, our calls for mental health services decrease as well. Does that help you out, ma'am?
Partially, thank you. I think there's a lot of questions that I still have and would like to follow up on. As we look at programs like this, I do think it's very important for us, and not just within, the mobile integrated health, but with the CIT program, about tracking how successful this program is. And I'm not sure we can track that if we're not capturing that data. And that I think can be problematic. So that would be something that I would like to see.
Councilor Beta-Stubbe, I have Eric and, Chief Enriquez and Mr. Ford wanting to answer the question, I think.
Thank you.
Thank you, Mayor Pro Tem and Councilor Stubbe. In that, what we're looking at is also in the RFP to get the mental health provider on board, that there's the intervention and treatment, and what they have also is the ability to do an assessment And with that assessment, then we can get into the intervention and treatment and be able to capture all that data. So we're going to rely a lot on the mental health provider to do a lot of that data collection for us to see what are the results that we're gaining from these individuals after they've had the intervention and treatment from a licensed or clinical professional.
Thank you.
Mayor Pro Tem, Councilor Abeta Stuvi, this is Paul Ford. I just wanted to add, so when we're looking at outcomes, that would be ideal. We would want to really take a look and say, okay, we went and saw 500 people. Well, what were the outcomes of these 500 people? Because that's really important. Well, one of the challenges that we have in the behavioral health community is that the behavioral health community, especially the stakeholders, when they have a patient, especially a patient that has mental health, is that they don't share that information. And so it becomes really difficult to track a patient through a stay and follow a patient through a 7 to 10 day stay at an acute behavioral health facility, and especially one that went through that facility and is homeless. Because ideally, I would have liked to have had a conversation with them before they discharged that person, but I didn't get the phone call, and then they discharged that person and he's homeless. And so it makes it really difficult to provide wraparound services to somebody when we as a behavioral health community aren't coming together and sharing information in interest of continuity of care. Now, in my case management program, we have something called an ROI, or release of information. And we usually try to get that individual to sign that paperwork, because then that allows us, or gives us permission to talk to other people, and we can fax that and we can send that type of stuff. But what about the gentleman that I saw who was having a severe psychosis, and I want to follow that individual and I want to help that individual, and I went to his house and I talked with his landlord, and he's evicted, but I have his brother's name, and his brother says he can go live with him, but now this person's at the hospital, and now this person's going to an acute behavioral health facility somewhere, and I want to share this information, which I found, but I can't get a phone call back because the healthcare community doesn't share information about behavioral health patients, even when to do so would lend itself to a good health outcome, and it falls under continuity of care under HIPAA. Those are some of the challenges that we can expect to have, that we're going to have to overcome, which is why in these slides we talked so much about the fact that we really need to come together as a behavioral health community and get all the stakeholders together to say, this is what we're trying to do to achieve a good health outcome for the community, and this is why we're going to need to, this is how we're going to have to do that, so that we can all talk to one another, we can reduce siloing, and we can facilitate good outcomes.
Thank you for that. With a follow-up with that one, do we at least track here at the city those that are able to be part of our programs, like programs, at least to kind of see how long that they might need those services, at least within our own programming?
Mayor Pro Tem, Councilor Abeta Stuvi, this is Paul Ford. Yes, we do track how many referrals we get, how many home visits we go on, how many people we enroll, how many people we expel, how many people we graduate. We're able to track all of that data internally, and we'll in turn be able to track that data as to how many mobile crisis responses we get, how many mobile crisis referrals we get, how many, and also how many individuals that we transport to alternative care destinations, which is a magical term for something other than the emergency room, which is a really hot topic right now because everybody wants patients to go somewhere other than the emergency room. So we can track all of that stuff. My concern is that if we want to determine how good of an outcome we get with this individual that we took to a facility somewhere, and what happened to that person afterwards, That's going to take a little bit of work as a community to try to gather all that information. And we have the same challenges in the fire department if we place somebody in a helicopter and we send them to El Paso. Obviously, our paramedics would like to know how this individual is doing. We provided all of this care. We did all these things for these individuals, and we want to know if that individual is okay or what happened to them so we can self-reflect and see how we did as a crew. And tracking some of these patients sometimes is complicated because of HIPAA. So I just wanted to throw that out there. And thank you for allowing me to speak on that matter.
I'm thinking and I'm hoping that Dr. De La Rosa, because I know he's the researcher extraordinaire, evaluator, that he will be able to help us and form some metrics for us moving forward. I just know I have confidence in him and he wants to speak here, so.
Yes, thank you, Pro Tem. Mayor, Councilor Stufe, this is Ivan De La Rosa. One of my role in working with this team is to really help them to think about evaluating success. So I really appreciate your comment about how do we know we're making a difference. From the research on this model, we know that it has been effective in reduction in alcohol use, drug use, reduction in emergency room use, reduction in overnight stays in hospital. And so we can capture that information about utilization of service, but also what difference has it made in terms of individual lives in the specific issues. And there's a wide gamut of problems that the patients and cases come before the team. But for each individual case, how do we know we've made a difference? So there's ways and models that we can capture that information. And so with the proposal was to capture information in terms of utilization, but really work with the individual contractor to find out exactly how are you measuring and capturing that. So I really appreciate you asking that question.
Thank you, Dr. De La Rosa. I want to make sure, I think this is an amazing program. I think it can be very effective and very useful. And I think being able to have the data that backs it up will make it that much easier to be able to make sure that we're advocating as strongly as possible for the right amount of funding for it to be able to expand upon it too. So I really appreciate that, Doctor. And thank you, Sergeant McCord, and thank you, Paul, and for answering my many questions. Thank you, Mayor Pro Tem.
Thank you, Councilor Betas-Tuvi. Next up is Councilor Sorg.
Thank you, Mayor Pro Tem. And I'd like to just say to the Fire Department of Las Cruces, you've always done an excellent job. And this is another example. This is the kind of thing we've been talking about for many, many years. And so I'm so glad it's moving forward. I would like to ask Paul Ford a question about the care for seniors, maybe, but anybody who is having health problems at home, shall we say. Have you ever discussed with a company in town here called Addison Care from Electronic Caregiver company that we have here in town? Have you ever discussed any of this information or what you're doing with them?
Mayor Pro Tem, Councilor Sorg. Yes, I've actually had meetings with Electronic Caregiver. I think they're a great organization. They have a lot of really great tools at their disposal. I think one of the challenges in our community is, and this is very important, and I'm going to go back and I'm going to have a conversation with Tim Watson at Electronic Caregiver about this. A lot of the individuals that we have, they don't have wireless internet. Some of them have challenges with power. Their power gets turned off. So it's not without challenges. But a lot of these individuals, some of them would benefit from having that service. I'm especially thinking about the congestive heart failure individuals. So for those of you that are not familiar, congestive heart failure is probably one of the #1 hospital readmissions across the nation. And why it's complicated for hospitals is if they readmit within 30 days, CMS doesn't pay for that. So this individual is then intubated in the ICU at $10,000 a day, and it's tying up a bed. And so it's very costly for the hospitals. One of the things that electronic caregiver do with their equipment is they can monitor that individual. They can put a scale there. They can do blood pressure. They can electronically notify. And I'm not 100% whether or not they would need wireless internet. Oddly enough, a lot of the individuals that the seniors that I see is far more complicated than whether or not they have fall detection on their wrist or things like that. They have deep-rooted problems with ambivalence towards change. They don't want to go to primary care. They don't want to go to the doctor. And they certainly don't want to go to the hospital because they fear that every single healthcare stakeholder that they loop themselves in, somebody somehow is going to wave a magic wand and they're going to wind up at an assisted living facility or a nursing home. And I work very hard with my seniors to try to explain to them that that's not how this works. I've had lots of conversations with Tim over at Electronic Caregiver on how we can work in the future. We have yet to iron out what that would look like in the future, but we have had conversations with them, and now that you've had this conversation with me, I certainly will revisit it with him because I think that there's some wiggle room to facilitate some good health outcomes there.
Okay, very, very, very well. Thank you very much, and thank you, Mayor Pro Tem.
Thank you. What a rich and robust dialogue here. I'm so excited about the possibilities. As you know, I had been working on this some time with the NGOs and other people, Chief Dominguez, others, and had recommended to Mr. Peely to work with Dr. De La Rosa. He had graciously agreed to, work through this as we prepared an RFP, or staff prepared an RFP. So I want to just say how grateful I am to the work. There's so much here. This is probably one of the best meetings I think we've had with staff and directors, sort of hearing from you data, but also gaps in service as we navigate to ensure that that 100% of our population get 100% access to important medical and behavioral health services. So I have a couple of questions that weren't asked, and I want to ask those questions. Mr. Ford, you talked about the seniors quite at length, and something that I'm very concerned about as we keep advertising that we're a retirement community, and I've often have asked since my first term, are we prepared for our aging population? And there, from my perspective, I've often have said, no, we're not. Talk to our city management about how do we get prepared, have really encouraged and advocated for senior services to do a wide assessment on where we're at, what we need moving forward. And so my question to you is, how do you work with senior services around sort of coming together and understanding from your both perspectives what the needs and gaps are, and then solutions and strategies moving forward?
Mayor Pro Tem Paul Ford, I'm really glad that you brought this up. This is a really challenging conversation. Yes, we are a senior retirement community. We're very community oriented. It's important for us to take ownership for that and make sure that everybody can be here safe. Some of the challenges that I'm talking about are challenges at the state level. So what do we do as the city of Las Cruces in order to kind of reduce that risk for those seniors, knowing that they're going to be on Medicare, they're not going to get care coordination, they're not going to get personal caregiver services. How do we and knowing that every senior is entitled to live in their home as long as possible, what do we do to fix that problem? And that is a major conversation, and I definitely think it's one that we should continue to revisit in the future. I've had several conversations with other city entities recently discussing what that major plan is going to look like in the future and what we're going to do and the challenges that we're facing. And so my recommendation and the direction that I think that we need to go is this. If Medicare is not going to provide caregiver services in the home, we need to bolster caregiver services for those at-risk seniors. If Adult Protective Services right now doesn't have Title 20 personal caregiver services with which to provide their members, which they don't, we need to figure out what it is that we're going to do in order to provide those caregiver services for those seniors. Another challenge that I'm seeing right now is chore services, cleaning, hoarder house cleanup. You know, who's going to pay for all of that stuff? Right now, I've got several referrals for houses in squalor that need to be cleaned up. They take a lot of time. There's nobody available in the community with which to clean those up. What do we do about those things? Those things are largely centered around the senior population as well. So what do we do to make sure that the homes are safe, the homes are sanitary, these seniors have what it is that they need in the home, and how are we going to go about making sure that those seniors have those needs in the future? And I definitely think we need to come together with City of Las Cruces senior programs and see if we can kind of supplement what Adult Protective Services was doing at some point and provide some personal caregiver services for those at-risk populations. And for clarification, senior programs already does have that program. They already have case managers for their seniors. I feel like in the future we're going to need more. They already have individuals that are providing chore services in the home. I feel like we're going to need more. We already have transportation in the community for seniors. I definitely think we're going to need to bolster dial-a-ride in the future if we're going to meet the needs of those communities. And that's what I've been voicing, is that we bolster senior programs with the amount of caregivers that they have, the amount of case management that they have, the amount that Meals on Wheels can serve in the community, and the amount that dial-a-ride. Now, one of the challenges that I think is challenging is a certain amount of senior programs is funded by the state. A little bit of Meals on Wheels, if not all of it, is funded by the state. How do we bolster that to make sure that every single person that calls Meals on Wheels is entitled to get a meal? And if they don't qualify, how do we get them to qualify if we deem that the need is there? How do we get a caregiver in place if we deem the need is there? And how do we get this individual to a doctor's appointment when they were at the hospital and they have discharge paperwork that says follow up with your primary care in 2 days? How do we make sure that Dial-a-Ride has enough vans and drivers and vehicles to accommodate those seniors so that they can be seen at the time that the hospital and primary care wants to see them? And I think those are really some of the directions that we would want to go in the future if we were looking at that.
Thank you, Mr. Ford. I appreciate that. Those are my sentiments exactly. Often, you know, honestly, one of the things when Mr. Peely began was my frustration and concern about really never hearing from directors, the chiefs, about your needs, being able to have really a transparent dialogue about the amount of funding that's going to be required. I hear it from the periphery, and you and I are kind of hang in the same circles behavioral health wise, right, at the local collaboratives and different things. And so it's been a huge frustration for me to not really be able to have this sort of conversation with you all about the needs. And honestly, this is sort of the first time that we're hearing from you all, and I'm grateful to that. And honestly, I'm advocating for a consultant to come in to work specifically with both the integrated health, senior services, to really those services. And Ivo and I have had a clear conversation about that. But also, I want to encourage. We have had just recently a conversation with Burrell College, stemming from the work that you've done, Paul, with Rebecca Farrell, the establishment of the Lions Club, sort of helping with the food distribution side, if you will. but it meets that need, the gap there of those folks that don't quite meet Medicaid and or Medicare, or Meals on Wheels, but still need all this help getting to and from medical appointments, food, bank, those things that are dire, right, for our seniors. And so I thank you for saying that. In the background, you and I don't talk, but I want you to know that I have enough folks that are giving me information, and then I'm fielding it to Mr. Beedley in hopes that we can make a real dent on this issue. So I would recommend that from our CARES funding that we start looking at, we funded drivers to help with some of this stuff. We funded, I don't see how, I think we can do this actually rather easily. And I'm counting on Mr. Beedley, right, to insist that we're collaborating and coordinating, not only internally, but externally with our partners. And not only that, all of us have relationships on this council with our state delegation and our federal delegation. These are some of the first times that I'm hearing these kinds of things, and we need to hear more of it and have that pathway to be able then to organize resolutions to send up to Santa Fe that says, absolutely, we are going to do these things. Medicare doesn't reimburse, Medicaid doesn't reimburse. Councilor Betas-Duvi talked about our funding our funding is different. In fact, our providers get reimbursement differently than up north in El Paso, but we did put a resolution together, and former Councilor Ekman and I worked with our insurance team up in Santa Fe to really look at that. So I see us making, small steps to really building a cohesive, consistent, seamless system, but we have to hear it more often. And so my other recommendation is, Paul, we really need you on the Health Policy Review Committee. I mean, that's the only way that we're going to hear from you on the ground so that we make better decisions moving forward.
So Mayor Pro Tem Paul Ford, I'm happy to be on that. I'm trying to be involved in as many healthcare committees as possible because I very much feel very strongly that it's important for the fire department to have a seat at the healthcare table. And I definitely think that we have a lot of experience, and I've seen a lot of things over the years, and the fire department sees a lot of things, and I think we know where some of the challenges lie, and I definitely would love to be involved in that. I think one of my greatest challenges is, like I said before, 170 emails, all of the home visits and everything else, and just trying to make it all work and then make all the meetings. That being said, I very much would love to be involved in that. I will do my very best, as I always do. If somebody would just forward me that information, I'd be happy to be involved in that.
Mr. Peely, and please forgive me, I'm not directing your staff. You figure out who needs to be there, but fire is an essential part, and they have not been a part of our health review committee, and they need to be if we're really going to make a dent. And our seniors, or someone representing our seniors, really needs to be there. Again, I'm deeply concerned. COVID just exposes us more. We need to hear this regularly so that we act.
Mayor Pro Tem, absolutely. If I'll talk to Mr. Ford and see what the time, the availability is there, and also Chief. But we'll make sure somebody from fire is there.
Thank you. You made mention, Mr. Ford, about your opioid overdose response team. Now, is that similar to LEAD? And if not, what is the differences or similarities as well? And is this overdose response team evidence-based?
Mayor Pro Tem Paul Ford. So LEAD, or Law Enforcement Assisted Diversion, is a program where law enforcement has some sort of a run-in with an individual that has a certain level of crime. They've gotten themselves into a certain level of trouble, but there's also that trouble that they've gotten themselves in is directly related to some sort of an addiction. Maybe it's a shoplifting charge. Maybe it's a break and entering charge. But it's all facilitated based on their addiction. So the way law enforcement assisted diversion works is that they're given an opportunity to enroll in a case management program where they're going to get MAT and a couple of other things. And the reason that it's successful is that, well, if I was faced with two different opportunities where I could either go into a community-based program and do case management and medication-assisted treatment, or I could go to jail, I think that I would probably choose to go into the program. And so I think that that's the basis for law enforcement assisted diversion. This specifically, our program is going to specifically target people that have experienced an overdose. Because after you experience the overdose, if there is any ambivalence towards change, it's fallen away a little bit. And so if we get there quickly and we have that conversation with that individual and go, hey, my name is Paul with the fire department, this is so-and-so, and this is so-and-so. We're in this overdose response outreach program, and we know that recently there was an overdose, and I'm really sorry about all that happened, but we're here right now, and we want to help you. And I want to hear what type of challenges that you're having, and tell me a little bit about yourself. I'll tell you a little bit about myself. And by the way, do you have food? Are you okay? How's your housing situation? I noticed that you got holes in your shoes. Can we maybe find somebody to get you some shoes? And by the way, have you ever heard about medication-assisted treatment and Narcan? You know, and so it's different in that way because there's really no teeth behind it. It has to do with how savvy and how good with words myself and the case manager and everything are to try to facilitate something good there. And so that's really the difference between the two. And it's also the timing. The timing is key. And if you get in there right at that time, then you can possibly do a little bit better good than you would if you went there 6 weeks afterwards.
Right. Mr. Ford, I appreciate that. I know that we talked in the past, and I probably heard this from you at a local collaborative meeting, our LC3 meeting, about the issues that we're having with folks that may have been given Narcan, released from the hospital, and then go back right into another overdose situation, right? And I know I received those numbers a couple of years ago. Is that continue to be an issue today?
Mayor Pro Tem, I think especially during COVID, patients that are making their way into the hospital, it's difficult to determine what pathway it is that they're going to take. Yeah. Also, these, like I've said several times in this before, and I very much want to drive it home, anybody that is deemed competent can make any decision they want to, regardless of whether it's in their best interests or not. If there was an MAT clinic right there at the hospital, and they said, we're just going to bring you over here, we've got burritos and coffee, and you're going to love it. If they don't want to do it, they're going to walk right out the door. And addiction is hard. You know, I get it as much as I can. It's so hard to facilitate that change. When that window opens, we just have to capitalize it on that at that time. And rest assured, I'm going to give everybody my card. They're going to get an overdose response kit. They're going to get all of these things. And hopefully they hold on to it. And one day when they finally reach rock bottom and they say, I can't do it anymore, they're going to give me a call. We're going to go over there. We're going to swoop in. We're going to get something done for them. We're going to facilitate a good outcome.
I appreciate that. Thank you so much. I think it's very much needed. Hey, there's Battalion Chief Cody. Yes, Haver. I hope I'm pronouncing that correctly.
Yes, Mayor Pro Tem and councilors, thank you. I just wanted to add a little bit of information in there real quick to add on to Paul. So just to make clear, the grant that we did receive, it was a 4-year grant. a lot of acronyms, but this is a federal grant that was given to the state through SAMHSA, through the Office of Substance Abuse Prevention through the state, and that's how we received this grant. It's based off of similar work that Santa Fe Fire Department is currently doing, and the scope of work of our grant is for the next 3 years to, again, the case manager with the EMT together as a team, going out and doing follow-up as a preventative measure for people that have experienced an overdose, to give them Narcan and the education to use the Narcan. And then, like Paul said, the other follow-up services. This is truly an outreach from the state to a couple of fire departments that they wanted to try to pilot this type of project to see what type of prevention they would be able to provide with a fire department involved. But just to make clear, it is a grant and it's only for 3 years. So at the conclusion of the 3 years, if not extended or something else doesn't come up at the end of the 3 years, that would be the completion of the opioid outreach program.
Battalion Favor, what are the metrics that you're actually striving for? Obviously, reduction in opioids, maybe the linking or referring to resources, but I know that through the state, they're very big on performance measures. So do you know what they are offhand? And if you don't know that, I'd love to see that in an email if you would.
Absolutely. Mayor Pro Tem and councilors, I can provide more of that information. We do have a scope of work. In fact, I'm looking at it right now. Just a couple of metrics right off the top are the number of Narcan trainings and the number of Narcan kits that we'll actually give out, the number of people that have actually been outreached. So is it just the survivor, or were there also several family members or friends within that household that we were able to provide education to as well? Also, there will be some metrics on knowledge, a pre and post test is what the scope of work calls it, but basically their knowledge about their situation prior to us engaging with them, and then a follow-up after the fact to see if in fact they ended up if they had to go to the hospital again, or what knowledge do they remember after the fact. There will be quite a bit of follow-up in this. There is a contractor through the state for data collection called PIRE that we've actually been working with very closely through the grant. And we will be providing regular metrics to them, and we'd be happy to share any of that information as we can with council and city administration as well.
Thank you. I really appreciate that. And Matt, I ask you that because I think it's something that we can mirror with the help of Dr. De La Rosa, the metrics used for the behavioral health arm, as I'm calling it, for your mobile crisis unit. I think that is important. And I hope that it's a part of our request for proposals so that people, agencies or entities that are interested, that they know exactly what we're going to be asking them related to that. But I think, Mr. Ford, you have something else to add? You're on mute.
Mayor Pro Tem, my apologies. Paul Ford, I just wanted to tag on there that the CARE grant is the Comprehensive Addiction and Recovery Act. And this is a state, federal money that has been handed to the state. And what they're trying to do specifically is, we have these opioid epidemic, and it's not just New Mexico. It's not just Bernalillo County. It's not just Doña Ana County. It's across the nation. And so what they're specifically trying to do is they're trying to determine what is going to be effective. And so that's what the reason that they want the data for. We're going to reach out to a bunch of different people. We're going to offer some medication-assisted treatment. We're going to provide a lot of Narcan education. If we revive a lot of people and we save a lot of lives because of the Narcan that we gave out, that's good. They're going to like that. If we are able to send a lot of people to medication-assisted treatment, that's great. If we come back with data that says that we went out to see a whole bunch of people, but nobody wanted to go to primary care, and nobody wanted behavioral health, and nobody was interested in medication-assisted treatment, that helps them decide how they're going to curtail their response in the future to try to attack this opioid epidemic that we have. And so I really think that's what it is that they're trying to do with this 3-year grant. And we're very happy to help them with that and to kind of engage in the community and raise awareness. I want many people to know that the fire department has this program in all walks of life, so that if they need something, they know that they can call somebody and we can help them in some way, shape, or form. And if that's what it is that we accomplish with this, then that's great.
Yeah, I appreciate that. Lastly, just to tag on, I know that one of the components is obviously fire and a licensed social worker, but don't forget about peers. I think peers are really important. Peer-to-peer navigators, as I know Chief Dominguez refers to them. I think that is an essential part of that. And just so you know, I've been talking a lot about there's a waiting list to train the peer-to-peer training. And so talking a lot about freeing that up or getting the trainer here to be able to offer that that piece that I think is so valuable as well. So that was just a recommendation that I have. The other questions that I have are largely now about the mobile crisis unit, if you will. How will you integrate 911 in that process, and a number? Is it would it be the 911 or the non-emergency number, and how? So I'll stop there.
Mayor Pro Tem and councilors, this is Fire Marshal Cody Haver. I believe I might be able to answer that with the help of Chief Enriquez. One of the purposes of the RFP is to truly get a better sense of how that might work. And so at the exact moment, we don't know exactly whether that would go directly through the 911 system, if there would be another non-emergency number. There's many other communities that do different things, including nurse triage within the 911 dispatch center, or they have another number that the 911 dispatcher would transfer to. So I think all of those things are pieces of the puzzle that will have to be figured out during that consultation phase with the contractors that we're looking at.
Okay, so I'm assuming that with the help of Dr. De La Rosa, and maybe this is for him, a question for him, what evidence-based programs did you look at, and which one are you basing this particular model after?
We were looking at a model from
Dr.
Colorado.
De La Rosa, will you state your name, please?
Oh, I'm sorry. This is Ivan De La Rosa. Excuse me, Mayor Pro Tem. We're looking at a model from Colorado specifically, and Chief Haver, I believe, referenced it when he said that he went and did a site visit. And the model, again, is using collaboration, interdisciplinary approach of law enforcement, mental health, and fire as a team, working closely with the support from psychiatric for those cases that need it. And the evidence there is very promising in their ability to address specific needs of patients and clients. Evidence related to reducing costs related to emergency room visits, stay in hospital, being able to access primary care providers, so connecting them into the system, keeping them in the system. One of the things that I think we've been kind of talking about this, but just to reiterate that COVID has multiplied the vulnerability within our community. Mm-hmm. So it isn't just exposing, but really multiplying. And so working with an effective team to really address case by case basis of those particular vulnerabilities that the patients and clients are experiencing is the key. So those are the models that is being based on. Perhaps Chief Haver can speak more to it.
Mayor Pro Tem and councilors, this is Fire Marshal Cody Haver again. Yes, so just in general, like I said, there are some other communities that have done some very similar things. San Diego Fire Department within San Diego has done something very similar. Also in the Seattle area, King County. The one that's closest to us really that has been a model for several years is Colorado Springs. They're actually one of the very first communities to do something like this. At the time when I visited them 4 years ago, they were already an established program with all of the arms of, community paramedicine that we were just talking about, or community, risk reduction. They had already been doing that for about 4 years before I visited. So they've actually been an established program doing mobile crisis response for the better part of 5 years, and even developing as a pilot program before that. And again, they've been peer-reviewed and published in several EMS and medical journals. Be happy to try to get that information to you if you're interested.
So Chief Hazer, is this the STAR program, or is this your more of the medical integrated health? I guess I'm concerned and want to speak to specifically the behavioral health. And one of the models that we had been sort of batting around in conversation is the CAHOOTS model that is known very specific to behavioral health response. And so although I think many of the calls, it sounds like have like a dual, right, or diagnosis, if you will, medical, behavioral health. But I just want to make sure that and the reason I know a little more is I've been doing some research, and I've just recently attended the National League of Cities, and they had these programs, the CAHOOTS staff out there, and the STAR program, which came out of Colorado. And so I just want to make sure that my interest is, of course, helping fire, but also to especially help law enforcement with these calls. There's just so many calls. And I think, as Councilor Bencomo eloquently stated, you can have the CIT training and do a lot of work, but I think from the standpoint of having professional folks that do this every day is an important element to me. And I want to make sure that we're getting, that we're selecting an evidence-based program that is going to really give us what I would like to see happen, which is the reduction. I don't want law enforcement a piece of this, even a non-uniform or person on this team. I think it's very important that we have case managers, social workers, prescribing psychologists that meet that team, and vans that go around that are unmarked, that go around, and that these calls go through the 911 system, or have a specific number, phone number, if you will. I just feel very strongly about that.
Mayor Pro Tem, this is Ivan de la Rosa. If I can respond to that, I think the what's special about this model is that the case will drive who is the lead on that particular call. And perhaps it will be more of a law enforcement issue in terms of de-escalating, or perhaps stepping in, and it will be more fire or the social worker in terms of resources in the community, or a clinical assessment. We really can't say that one particular discipline is going to be driving the bus, if you will. It's a collaborative effort among the different disciplines, really adding their knowledge and their expertise to that particular situation, because the complexity of the cases before us warrants bringing all those pieces together. And so it really isn't a police model or a fire model or a social work model. It really is an embedded team working together, very highly focused, very trained, able to communicate with each other, and really focus on addressing the needs of that particular patient before them, and getting them into the system and keeping them in the system, as I said.
Sure. Okay. Thank you, Dr. De La Rosa. So Are you familiar with the Cahoots program? And was there an opportunity to look at that or speak to this particular group? I mean, they've been doing it for decades. I don't know how long this particular program that you're referencing has been in existence, but they've seen a reduction of the number of calls, the hours that it's spending, that law enforcement and others are expending on these particular cases. And not only that, they've seen an $8 million reduction in terms of the money that it's costing all of us, right? Because they keep presenting to the ER, there's not a seamless system of care.
Mayor Protem, this is Van de la Rosa. I looked at a number of models when I was doing the literature search in terms of the evidence of the different types of models, and each model is somewhat different in terms of what they're trying to do nationally. But the common theme was that it was an interprofessional, interdisciplinary team working effectively or together to address those particular needs. But I will look specifically at that Cahoots model and look to see what we can use from their approach that may be applicable to our border area.
Absolutely. I appreciate that. They do offer technical assistance, toolkits. Again, I've been able to, listen to their program a few times. And so if I'm satisfied with you on the case there, Dr. De La Rosa, and looking at that, I trust you implicitly. So thank you for that. The other mention, and I don't know if it was on slide 29, was on the creation of a mental health coalition, and I would caution us doing that. We have a amazing local behavioral health collaborative, the LC3, that's working closely on assessing, evaluating our system. There's a group of folks that are, Roseanne Vasquez, Jolene Martinez, people that we're all very familiar with that are working on this and doing some excellent work. I just don't see the sense, from my perspective, in developing a whole different coalition when there's one already that's doing all things behavioral health.
Mayor Pro Tem Paul Ford, yes. So the LC3 model, I'm actually a board member over there, and that slide was written that way because we wanted to make sure that it was clear that we can do the mobile crisis response program, but we also have to have buy-in from the community. We have to have places with which to take these patients in order to facilitate good outcomes. And so, yes, I don't feel like it's necessary to reinvent the wheel there. I have conversations with Miss Roseanne on a regular basis. I'm actually having a conversation on the side here with her right now, and I will work with Roseanne to kind of make sure that we're doing that. I think I've talked about widespread MOUs to share information until I'm blue in the face. I will always continue to talk about that, and I think that that's a good avenue with which to accomplish that. So thank you for bringing that up, and I apologize for the confusion.
Thank you, Mr. Ford. I appreciate that. I also want to remind us that in the State of the City address, Mayor Mihigashima spoke specifically about the development of a behavioral health district and what that would look like in terms of our county, bringing in our municipalities, our commission, county commission, throughout our Joniana County and all the little townships and villages to be a part of this behavioral health collaborative and maybe looking at the behavioral health district as a funding source, right, for organizations and agencies. And I don't want us to lose sight of that. I think it's really important that we're tying this in some shape or form, because I think will be successful collaboratively. And it sounds like you all want to be with a multidisciplinary team approach and understand the importance of that. Sorry, I'm looking through my notes. You know, the other things are what I think, and I keep hearing, you know, and I hear this often, and something that Mr. Peely and I have talked about, and what I have is lobbying and advocating for is paying for an evaluator for the city to be able to look at these programs that you have and to include the CIT in terms of the effectiveness at using qualitative and quantitative research. This is so important. You know, this is important to council. It always has been. We're asking about data. We're asking about efficacy and how we can improve moving forward. And so I would like that to be a component of this, is making sure that we that there's metrics that we're following, that we're not creating something at the end, that we go in already with these in mind. And again, I've talked to City Manager Peely about that. I just think there's an immense amount of time being spent on this when that's not your expertise, and we can find people to be able to do that. So that not only, and I'm visioning going for bigger grants. There are grants from SAMHSA and other organizations that we could easily look to moving forward, so that the state and the Fed, you know, aren't the only individual entities providing resources to the city. Mr. Peely, did you want to say something?
Mayor Pro Tem, no, I just turned on my camera because you mentioned my name. I just wanted to let you know I'm
I wanted
here.
to see your face. Yes. Okay. Let's see. I think that, here we go. Here's some of their. Yeah, I think I've mentioned everything, and just reminding folks that as part of our comprehensive plan, Elevate Las Cruces, you know, some of these social, emotional types of, which probably for the first time has been incorporated in our plan, making sure that that 100% of our folks get 100% of quality services, and so I want to make sure that we're referencing that a lot of work has been put on, you know, Elevate Las Cruces is real proud of that comprehensive plan. But, you know, as you talk about housing opportunities, and that's where I'm super concerned is here we are, you know, working towards building up this behavioral health arm with a crisis response. And I think what we're going to find is our struggle is housing folks, and what are we going to do about that? And so I want to advocate here using some of that our CARES funding to develop, be it a hotel, you know, that's no longer a hotel, but finding a facility that we can utilize to house folks is going to be really important in my estimate moving forward. And if we don't do that alongside building this crisis mobile response, I think it's going to be in vain, frankly. That's all my questions. Thank you so much. I've appreciated this. I see Councilor Bencoma has her hand up.
Thank you, Mayor Pro Tem. Yeah. Earlier, Mr. Ford was talking about some of the concerns and issues that he was seeing, and I wondered, and the thing that sort of struck me was particularly the list he says he has regarding homes that are really not, whether it's hoarding issues or like just really not livable and unsafe. And, you know, one of my biggest frustrations with the state is that there is this giant $20 billion permanent fund that we call the rainy day fund that we refuse to tap into, even though it's pouring in New Mexico. And that's frustrating, right? That frustrates me that we refuse to tap into that to take care of some of the most vulnerable. Now, I know that we can't use the Tell Shore Fund to alleviate all our issues. I know that it's not going to be there forever. I know all those things. I also wonder, how we can better utilize Tell Shore funds when it comes to things like this. Like, this problem is very acute and it's very unique and it's very specific. And I wonder, right, if there could be a way that we can start issuing grants or some sort of program that helps with these really serious cases where families or elderly particularly are living in situations where it's just not safe. And so I wanted to pose that. Again, I'm only been here a year, less than a year, feels like a lifetime. But I don't understand quite yet, right? Like how the city plans to utilize those resources. And so I just wanted to lift that up. I'd love to have a conversation with Mr. Peely about that. But I think it's worth mentioning, right, that there are these funds that could be used potentially for some of those really serious situations.
Thank you, Councilor Bencomo. I really appreciate that. We do, as you know, offer up grants. There's funding opportunities that Natalie Green facilitates for us. But I wondered with that, and maybe Jennifer Vega Brown and others may be able to help us facilitate this idea with the question that Councilor Sorg had to Paul about the electronic caregiver and just the amount of barriers that our seniors have in relation to internet and utility. Not having consistent utilities is if we can offer hotspots and those kinds of things, so that if they did get the electronic caregiver tech, that we'd be able to, because these are our most vulnerable. These are people who have serious medical conditions. And if we can offer that up, I would say we're better for it. And I think we are able to do that as the safety and well-being of our elderly. So with that, I see Mayor Mihigashima back on. Next up, Mayor, welcome, is Chief Enriquez.
Okay, Chief.
Oh,
where are you guys? Which one are you guys on?
Number one.
You're still on the first one?
3.1, Mayor. Yes, sir.
Okay. Chief, go ahead.
Mayor Pro Tem and Council, I just wanted to finish up by saying thank you. Thank you for your support. Next month will be 23 years that I've been in the fire service. And I can tell you, when I came in, it was a rookie's duty to call the vecinos, because we had a vecino program to help those individuals that were living by themselves and needed some attention. And we would call them by phone. Today with the MIH, we're doing it as house calls and following up and aligning their resources. So as I said from the beginning, it was not only a pleasure, but it's an honor to introduce and to give this update that Paul Ford presented, because we're very proud of where we've come and what we've done. And now we're moving on to the next steps of a mental crisis intervention team with the police and working with the community. So I'm glad that we were able to do this. I've tried to get it on the work session for a couple of years, but here we are today, and we will continue to thrive and work at this. So thank you for all your support. I really appreciate it.
Okay, well, great, Chief. Thank you for that. And I'm sure all the questions have been answered. So if there's nothing further, let's go ahead and move to item number 3.2, Limited English Proficiency Plan. I believe Joe Richards and Gail Estelle are going to be presenting.
Good afternoon, Mayor and Council. This is Joe Richards, Human Resources Director. With me today are two other HR staff members, Gail Estelle and Debbie Childress. I want to thank you for having us and allowing us the opportunity to present to you some updates to a proposed citywide limited English proficiency plan. So we'll start with the presentation. I believe it's getting prepped right now. Bear with us.
So you guys are serious. This really is 3.2. You guys spent 3 hours on item 1? Wow.
Yes, it was very important.
Okay, no, I got you. When you had Chief come on, I thought he's barely starting his presentation. I didn't know if you'd started at 3.3 first and then backwards, but okay, good. No problem. No, that's very important.
So we'll go ahead and get started, Mayor,
Okay,
with
sure.
a little bit of background information.
Sounds good.
So there are 3 regulations that pertain to the requirement of having a limited English proficiency plan, or LEP. The city's been compliant over the years with these regulations, as one of the requirements is that any organization that receives federal assistance have a plan in place. Once this plan is in place, then it pertains to the entire organization. Those that are in place right now have been developed by a couple of specific departments to use for grant funding. A couple of years ago, it was recommended that we develop and implement a citywide plan that can be used by all departments. So we initiated that work. Gail worked on a plan that was developed a couple of years ago, but it never got fully implemented. So when Gail brought that to my attention, we revisited the plan and decided this was the perfect time to reevaluate, look at our statistics, and then maybe expand on the plan and how it gets implemented. So Gail proposed a committee that included Jamie Rickman, Jennifer Martinez, and Carla Walton, as well as Debbie Childress, who provided some invaluable feedback and recommendations. So I want to thank them for their contributions. Their work is really a result of these updates and recommendations that we're bringing forward today. Those will include a component for training staff, making them aware of the availability of these resources and how to implement these resources, as well as a communication plan that goes out, of course, to staff and also to the community so that they know the resources that are available. We took a look at what's called a 4-factor test. Next slide, please. So this 4-factor analysis was completed to identify how we properly administer and use these resources to assist people with limited English proficiency. We want to make sure that they have full access to our programs and activities, as well as any information that they need from the organization. So the first factor is used to assist and determine the scope of languages that may need to be interpreted. We can evaluate that by looking at our demographics and researching that information, of course, by using census information, as well as other community partners, the schools, and things of that nature. The second factor is an assessment to determine how often these services may need to be provided. And that's information that we can really obtain by getting feedback from staff and those people that interact on a daily basis with residents that may have limited English proficiency. The third factor will determine the impact on our actual or potential services that we may provide to our residents. So any impact to not having a plan in place and having these resources available could prolong services that are being made available to these individuals. And then the fourth factor will provide analysis to determine the demand. This will help us to ensure that we have available resources so that if we need additional resources, we can make that determination and proceed accordingly. With that, I'll go ahead and turn this over to Gail Estel so she can provide you a little more information about the plan and the data that was collected.
Thanks, Joe.
Good afternoon, Mayor and Council. This is Gail Estel. I'm the EEO ADA coordinator for the city. So what I'm going to do is I'm going to tell you just a little bit about the assessment that we did with the 4-factor analysis and the data that we came up with. The definition of a limited English proficiency person is a person who does not speak English as their primary language, and also who has a limited ability to read, write, or speak or understand English. And so the data you're going to see on this one is taken from the U.S. Census Bureau's American Community Survey. And this survey has 2 classifications on how well people speak English. And the classifications include speak English very well or speak English less than very well. So when we took this data, we took into consideration minor children who may be receiving services or in programs that the city had, and that they may have LEP guardians or parents that the city may need to communicate with, need to interact with as far as their child is concerned. And so that's why we use population over 5 to gather our data. So for the purpose of this particular slide, and then also the next slide, we used an analysis. It's an LEP threshold population. And what that's defined as is a population that has at least 5% or 1,000 people, whichever is less, that speak English less than very well. So what this shows you on the screen is data from Doña Ana County. And what it tells us is that 56% of the people in Doña Ana County speak a language other than English. And of those 52% folks, 50% of those folks are Spanish-speaking households. And of those 50% Spanish-speaking households, 15% of those households speak English less than very well. Now, you'll notice that this data is from the census from 2017. This will be updated as soon as the 2020 data is published. And now we'll review our limited English plan. We'll review the statistics to determine whether we need to, update and change the statistics in the data when identifying individuals with limited English proficiency. Okay, and then the next slide talks about specifically Las Cruces and the population in Las Cruces. We used the same LEP threshold, the 5% of the population or 1,000 people, whichever is less, that speak English less than very well. And so what it showed for Las Cruces is that 39% of the households speak languages other than English. And then of those 39%, 36% of those households are Spanish-speaking households. And then of that 36%, we have 8% of those households that speak English less than very well. And so this does show you between Doña Ana County and Las Cruces County that we have a fairly large number of households in Doña Ana and Las Cruces that speak English less than very well. And so what this plan is, and this is not to say that we don't already do a lot of this stuff, but with this plan and the update, what we wanted to do was enhance what we are already doing and provide more services and better services than what we have been providing. And so these statistics will help us, determine that too. Also, what the data showed was that the most prominent languages in Doña Ana and Doña Ana County and the city include Spanish, Navajo, Zuni, German, and French. And when we're determining the identifying LEP persons, what we have to do is determine the 6 prominent languages in that community. And so those are the ones in our community. So now that we have identified, and in our plan, we identified the LEP persons with these statistics, then on the next slide, it will show us how we are identifying these percentages of folks who speak English less than very well. The staff is certainly going to be the first point of contact in identifying individuals that may be limited in their English proficiency. And you'll notice here on the slide, there's a part of a poster. It's your right to an interpreter. And what this poster says is you have the right to an interpreter at no cost to you. Please point to the language and an interpreter will be called for you. And there's like, it's an 8.5 by 11 poster, and it's the front and back with the different languages. And so, when the person comes in and they are identified as an LEP individual, then this poster will be used to also help that staff identify what language that this person may need to, needs assistance in. And then from there, we have resources that will help allow to, procure the appropriate languages for the assistance that that person may need. So then the next slide talks about, the language assistance. And there's two kinds, right? There's the oral and then there's the written. So with the oral communication, that's delivered by a qualified bilingual staff member that's communicating directly with that LEP person in their own language. All right. And then an interpreter, as part of the oral, is taking a message spoken in one language and then interpreting that into another language. And that can take place, a one-on-one person, over the telephone, or via internet or video interpreting. And then the written translation is a replacement of the written text in one language to another. Now, the city, the LEP plan is required to identify what we call vital documents. And these vital documents refer to information that's critical in accessing, programs, activities, or services. A document that maybe require a signature or something that, is very important. Now, each department within the city will identify what vital documents are in their particular department. A lot of documents are already translated into Spanish. And according to what the statistics say here, the city is only required to translate vital documents into Spanish at this time. However, if someone comes in that speaks a language other than Spanish and requests us to provide written information translation, we are required by the federal law to do that. Okay. So the city is going to arrange for those vital documents that are meaningful so that each individual, no matter what language they speak, have the ability to read and understand what it is that they are asking for. So then the next slide, we talk a little bit about the different resources that we have at the city. Some of these resources we already have, some of these resources we are still developing. But certainly bilingual staff will be identified by each department. We have some staff that say, well, I speak Spanish a little bit, but, I don't really know if I can get across, what somebody really wants to know. I'm from Tennessee, and my Spanish is mi casa, su casa, and I say that with a Southern accent. So, clearly I'm not going to be someone that's going to be, a bilingual staff at our city. But each department will identify, and then what we'll do is we'll have a register of bilingual people who are staff who have been designated or identified as bilingual staff. And this is, probably the most economic use of our dollars to serve LEP persons. And this is, bilingual staff will be used more like on day-to-day when somebody comes in and day-to-day with that. But then we're going to use, qualified interpreters and translators when we really need to make sure that the information that we're providing to an individual is accurate, or if there's a lot of details, or it's really important and critical that they understand every aspect of what it is that we're interpreting or translating. Video conferencing is another interpreting service that, we're pretty excited about. We currently have a vendor, and I'm going to tell you a little bit about that in a few minutes. So that's really, I'm really pumped about that piece of it. But we do currently have 6 interpreter services vendors, and those are vendors that do interpreting, and they do some translating, and they are mostly local. I think one of them is in El Paso, but those are local. And we can call those folks. Most of them require 24-hour notice. There are a few that do, like emergency things, but then, of course, there's going to be an extra cost attached to that. The next one there is video conferencing. And and this is one of the things that I've worked on. I've been with the city for about 3 years now. And when I came in, at the time we had a different HR director, I think it was my second day on the job, and he said to me, you need to develop or update our LEP plan. I came from a nonprofit, organization. I had no clue what an LEP plan was. And so we got together with this, and I said, well, what I think we need is some video conferencing. So we did some research, and we now have a vendor who will do the video conferencing for us. In addition to the video, they do the phone, and then they also do translation services. And so Certified Language International is the video conferencing vendor that we currently have. And they can translate into 200 plus different languages. And so there's a large range that they can do that. And they're a 24/7, 365, organization, so that we can call them up, anytime, any day if we need translating services. And they do, like I said, over the phone, video interpreting, and then also translation. So let me kind of give you an example of how that video conferencing might work with the Certified Language Internationals. Let's say somebody comes in to visit with me, and I determine that, English is not their first language, and we're going to need some assistance in communicating. What I do is I go to CLI's or the VRR's website. The city has an access code. I'll put in this access code, then I'll sign in with my name and my ID number and the department that I'm from, so we'll know when the bill comes in, who's going to get the charge. And then I select the language that I want to be interpreted. And I am then, within 2 minutes, I'm connected with an interpreter, and it's on the screen. And so then what I do is I just, I can talk, and then the interpreter's working with the person that's sitting with me that doesn't understand English. So within 2 minutes of someone coming in that doesn't speak the same language that I do, and that we need some help communicating with each other, we can have that service provided, which I think is pretty cool. And then family members or friends. Family members or friends are not typically used, and it's not really a good idea to use interpreters unless that person specifically, wants a family member to do that. And then that would be after the city staff has told the person that, we're going to give you an interpreter. We're going to provide this without any cost to you, because some folks may think there's a cost. There's absolutely no cost for us providing interpreting services for you. Now, in some cases, children under the age of 18 will not be used because, to ensure confidentiality, or that the information is actually provided and communicated in an accurate way. And so you can see now that we have a good foundation for providing the services. Our plan, and Joe's going to talk about this a little bit later on, is to, what's our next step in making sure that all the departments in the city really know and how to, access these services. And it's kind of cool because I had somebody call me, it's been several months ago, and they said, I have a person standing here in front of me that speaks German. Do you speak German? And I said, no, but I speak Southern slang. That wasn't what they were asking for. And so it was really cool that we were able to provide, someone who could translate and speak with this person in German at that particular time. So then, with our plan, we're going to monitor and update it, as needed. And it's going to be on an ongoing basis. This is going to be like a living document. And so some of the things that we're going to use to monitor and update our slide is we're going to, reevaluate and identify the LEP population. Like I say, so when the new 2020 data comes out, we'll look at that again to see if the numbers have changed. And if the numbers have changed, then we're going to assess the current level of the services that are being delivered, and what do we need to do to enhance that? What do we need to change? What do we need to do so individuals who are limited in their English proficiency, we make sure they receive the same services that everyone else does. And then we're going to look at the availability. Maybe there's new, technology that's come out. And so we'll look at that when come to updating our plan. And then we'll evaluate complaints. And the language access discrimination complaint form procedure, and that's actually in our plan. What it does, it establishes a way for members of our community who feel that they have been denied language access, discriminated against as far as language access, have a way to file a complaint. And this document will be placed on the city website. It'll also be placed on SharePoint. So if someone comes in, let's say, to Human Resources and says, I feel I've been discriminated against as far as language access, I want to file a complaint, that staff person will be able to go on to SharePoint and give this person a copy of the complaint form. Then the complaint form will come to my office, and then, it will be evaluated. And so annually, what we'll do is we'll look at those complaints, and that's going to help us determine, have we been successful, and what else do we need to do going forward with that. And so we will look at periodically, updating and revising our plan as necessary. So also part of our plan is training. So I'd like to introduce now Debbie Childers. She's an organizational development administrator, and she's going to discuss the training part of our LEP plan.
Well, thank you, Gail. So I knew a Gail Estelle like from 35 years ago. That's not you?
Probably. I've been around at least 35 years.
Okay. Nice to see you again.
Thank you.
Okay, and I'm sorry, who's gonna speak now?
Debbie Childress.
Sure, Debbie Childress.
Good afternoon, Mayor and Council. My name is Debbie Childress, Organizational Development Administrator. Staff training will help ensure all city employees understand the importance of and are capable of providing effective communication to individuals with limited English proficiency in city programs, as well as services and any activities. And the training plan will encompass going over the city's LEP policies and procedures, when and how to access and utilize the oral and written language assistance services that Gail talked to you about earlier, how to work with the interpreters and the translators. Another component will be how to communicate effectively and respectfully with individuals with limited English proficiency. A couple years back, we had a program where we had DACC come in and provide some Spanish language training for business needs. And we really focused a lot on customer service and culture and respect. So we look forward to incorporating that as well. And then also identifying and requesting translation of documents. So departments will keep track of their bilingual staff. And as Gail mentioned, we'll continue to update. People move in and out of departments, move in and out of the city. We'll continue to keep track of those people that will be helping assist those individuals. And then we're also planning on adding all of our training for LEP, to our new hire training. And so this is something that we want to make sure we have a good communication effort, that we're providing information out to everyone so that not only they're aware, but that we're also providing training. That's my part of it, and I believe Joe is up next.
Okay, thank you, Debbie.
You're welcome.
Joe Richards, HR Director for the record. So going forward, next slide, please. These are our next steps So we will seek approval of the plan. And of course, as Debbie mentioned, doing some communication and training, and then provide also information to residents and the public about the information that we have available and the resources available. So with that, with these next steps, we'll stand for any questions that you all might have.
Thanks, Joe. So basically what this was primarily informational, and then later on bring it to council for approval. Is that correct?
Mayor and Council, Joe Richards, for the record. I believe that this would just go to the city manager for approval.
Oh, okay, so you don't need us to, okay, good. Looks like we have Councilor Bencomo, Beta Stuvi, and Gandara. Councilor Bencomo?
Thanks, Mayor, and welcome. I'm sure you thought you were going to get in here at the end of this meeting.
Yeah, no, I was already in my chair and I turned on the TV and it's like, what? Okay, so I better, no, I'm just kidding.
Thank you. And thanks so much for the presentation. This is very interesting. Those statistics are really important. I'm glad that you presented those to us. I had some idea, right? I think New Mexico, Las Cruces is probably one of the communities that has one of the largest immigrant populations, Deming, Luna County being probably the biggest. Las Cruces is definitely one of the biggest with 12%. So I'm really glad that you brought that to us. I just have to say a quick story because I think it's important that when you were talking about considering populations 5 and older, I cannot tell you the amount of times that I translated for my parents multiple places. I translated often my own parent-teacher conferences, which was pretty fun, being a pretty devious child, at the bank, at the doctor, which got pretty awkward, at the mechanic, which got tense because my dad wanted me to translate things to the mechanic that I didn't even know in English. So it's definitely really, language access is actually a really critical issue, and I think that when we're, as a city, in order to provide great customer service, we really have to consider language access. So this is incredibly important, and ensure that, kids aren't translating for their parents when they go to utilities or whatever. Honestly, my biggest question is around council meetings and work sessions. I recently heard that Albuquerque, through their Office of Immigrant and Refugee Services and their Office of Equity and Inclusion, that they have been working on ensuring there are interpretation services at any public meeting. And to me, I think that that's important, whether it's even on like an RSVP basis, I'm not sure, but will there be a piece in this plan that really advocates for having interpretation services at council meetings, whether they're through virtual or, when we're back in person?
Okay.
Mr. Mayor, councilors,
Yes,
I'll defer to Gail on some of those resources, but I do know that some of the vendors that we have can be made available. She referenced, I believe there's at least half a dozen different vendors right now. So I believe their availability could be made at those council meetings. Gail, do you have input?
Yeah, and right now it is on a, we put on all of our agendas and everything. If you need, assistance, it's not just with, an ADA accommodation kind of thing, but if you need language assistance too, if you let us know in 72 hours in advance, we can make sure that there's an interpreter at, that particular meeting. However, we have discussed in the committee meeting, and Jamie Rickman was really important, with putting this in, is that we do need to come up with a plan and add this into our plan about having an interpreter at each city council meeting or any other meeting, community meetings. Jamie in particular with her community meetings when she goes out to do community access and research and those kinds of things. And so, yes, we are looking into that to see if, maybe some of the vendors we have now or do we need to look out further and broaden our scope and see, who else is out there? But that is something that we're aware of. We do think it's very important and that we will be addressing.
Great, thank you so much. I think even needed for constituents.
Councilman Como? Let me just share that something with you. So just real quick, in the past, when usually if they do need an interpreter, their friend will ask the city and they'll have that accommodated. Because I've seen that. It's when it's a hearing. Let's say they go before the city council for something, and maybe they need something done. And then a lot of times when it's on TV, I think the closed caption provides that. But I just want to let you know that a lot of times they've been really good, where they'll just they'll give the city a little bit of a head start, and then they'll have the interpreter. In fact, and it's not just for Spanish. They even had it for one time a gentleman needed for a different language. But this was really impressive, what the information that we were just given. So I didn't mean to interrupt, but I just want to let you know that usually a friend of the person who needs that interpretation has that. They let the city know in advance, and then it's usually accommodated. But it's good to hear that they're looking into the other, like Gail just mentioned.
Great, yeah, that's really important. Honestly, I didn't know, and I've been working with predominantly people who speak Spanish and doing lots of advocacy and at the city and county and state, and I did not know that was available. So I think that that's important to make sure that we're very clear and open and advertise that service. And then my last other point is just around compensation for city staff who are bilingual, who get used for those kind of in those kinds of situations. I am English is my first language, and just because I speak two languages does not mean I'm a good interpreter or a good translator. And that's like a very specific skill, and it's a very specific career choice even, right? There are people who make their careers out of translating, interpreting. And so I want to make sure that even if we are for internal use, tapping into bilingual staff, that they are being compensated for providing that additional work for whatever department they might work for. Thanks, Mayor.
Sure. And Gail or Joe, do we have, and you see this especially in other meetings that I've attended, where let's say it gets to the point where we may need some of those headphones, and then you can have someone. The good thing with the internet is someone could be watching our meeting and literally interpreting from home. But while they're interpreting, the ones that need the English translation, they'll be able to have headphones. Do we have headphones? Do we have those available?
Not to my knowledge. I could speak with Dominic. I don't know that we do right now, but he would be able to answer that question, and I'd be more than happy to find that out and then, let you guys know.
Yeah, well, or just we'll let EFO know, and if we don't have any, I think we probably should have some, because it's as our population grows, it's going to get to the point we're going to need some, and then we can just always add to them. So I think that's probably not a bad idea. Okay, thanks. And next we've got, hey, Chief Enriquez, I don't think you have a question. You probably just didn't put your hand down. So I'm just going to guess here. Councilor Beta Stubbe.
Thank you, Mayor. And thank you, Joe and Gail and Debbie. My question revolves around that of American Sign Language, on what types of platforms we utilize right now for those types of systems. And if they're, I know what one business does, it's like almost like iPads that you tap into so people can view back and forth if we use that type of technology, or if we have different systems that we need to utilize for that.
Okay. Well, we actually have both. Some of our vendors will actually come on site. So if they know ahead of time, they'll come on site and provide that. Also, Certified Language International, American Sign Language is one of the languages that they interpret in. And so we can also use that from the computer. You can also use it from your cell phone if you need to do that. And so we have, according to what the situation might necessitate, if somebody's, if we know it in advance, we might use the on-site interpreter. If it's someone that comes in, we can always use the Certified Language International.
Okay, fantastic. And that's all my questions, Mayor.
Thank you. Mayor Pro Tem Gandara.
Thank
And thanks
you.
for running the meeting.
My pleasure, Mayor. Thank you. Good practice. Thank you, Gail and Joe and Miss Childress. Childress, did I get that correct? I wanted to ask, because it's something that was said. I was assuming that this particular policy has been in existence for some time, and then 2 years ago or whenever someone started, the former director said, let's update it. So we've had it, or is this all new?
Mr.
No.
Counselors, this is Joe Richards for the record. Yes, ma'am, there have been plans in place for a number of years in order to comply with those federal guidelines that require you to have an LEP plan in place to get federal aid. But the plans that were in place had been developed by specific departments. So we've been in compliance because those plans would apply to the whole organization if needed. But then a couple of years ago, we were notified that, or recommended exactly that we should have something that's more universal for the whole organization, something that we could develop and have consistent resources and provide that to everyone for their use, and make sure that we have that available to our residents that need those services.
So, Ms. Richards, the forms and the, that were presented or accompanied the agenda item electronically to include the poster, are all those new elements, or are they old and you're just updating?
Joe Richards for the record, Mayor and Council. Some of those forms are newly developed. Some of the information that Gail was able to research and obtain from other organizations and from other resources are new in the plan.
Now, does that include the releasing the city from any wrongdoing or liability in the event an individual wants to use some other translation service or translator?
Mr. Mayor and Council, yes, I believe one of those documents does include, for instance, if they choose to use their own family member, then there is a release that they're essentially saying, this is my choice. I've been provided access to this at no cost. However, I've chosen to have my family member interpret for me.
And so what if they didn't want to sign it?
Mr. Mayor and Council, that's, I guess that's a really good question. We would have to do a little research on that to see what we could do to document that appropriately.
Now, did all the policy and the forms and that particular form get vetted by our legal attorney?
The plan has not gone through legal yet. And again, that's part of our process. We'll be vetting those things and reviewing with the city manager before it gets implemented.
So is this you have funding attached to this?
Mayor and Council, Joe Richards again for the record. We do have some funding available in HR that we've used for these resources. Right now, it's not determined as to what the cost may be going forward because it'll depend on the utilization for the resources that we've been able to outline. So that's part of what we're going to have to be tracking to evaluate needs going forward.
What is the current amount?
Mayor and Council, Gail, correct me if I'm wrong, but I believe we have allocated $6,000 for these resources.
So that includes a list of the list that you mentioned of contractors with that have the skill set for the various languages and those kinds of things. Yes.
Mayor and Council, Joe Richards. Yes, ma'am.
Okay, and then I guess I wasn't aware that, that statement that says if you need assistance or whatever, I thought it was more ADA requirements. I don't know that people know that, right? Those of us that have participated. And so I would like to encourage a different sentence there that encourages, that we have translation if you need it, it's available. I hate, and not only that, I guess I wish that we would just do it and not have someone notify us with a certain amount of time and those kinds of things. I would like for us, and I've been advocating for this for some time, that we at least have the Spanish speak the simultaneous translation provided at every meeting. I think it's important, and I'd like to get to the point to where the county is at. They offer that all the time, regularly. They don't need someone saying, so many days in advance that it's required. I'd really like to get to that. So if that's not only, Mayor, to your point about having the devices, I think I would like to see that. I think that's also important for not only our regular and our work sessions, but any committees, boards that we have, that we should do that as just a natural thing that we do moving forward. So with that, Mayor, thank you. Those are all my questions.
Sure. I think if the city can take a look and see what that would run, Mayor Pro Tem, I think that would be good, and then bring it back to council, because I think you'd be, if we have it for every board meeting that we have, I think it'll be a fair amount of money. But we'll see. We'll see how much it runs. I don't think it's a requirement from ADA. I think we just have to make a reasonable accommodation. But I don't know. We'll see from what Jennifer has to say. At least we're not like what was that case? Was it Maldonado versus the city of Altus or something like that? You don't know what I'm talking about. I was reading that one day. It was a totally different thing. Councilor Flores, are you going to volunteer to interpret for us?
No.
You want another job?
No.
Yeah, we'll just pay you.
I actually, simultaneous translation, I've only met people at the UN are simultaneous interpreters, and I don't know how they do it. And I know one person, and you know her too, Mayor Pro Tem, who is probably the most amazing, talented simultaneous translator. That's Susie Chaparro. I mean, she is amazing. It's like, I don't know how they do it, because syntax and word, which is word order, and then Spanish and English have a lot of cognizance. So you have one word that sounds like it means this, and it doesn't. And then we have a lot of slang. And then a lot of people that I know, who I think a lot of us know, will use the word brecas. Well, that doesn't exist in Spanish. Brecas is brakes in English, and in Spanish it's frenos. So, there's a lot of words like that. So no, I wouldn't volunteer for that job, wouldn't pay me enough money to do it, because it is a work. I mean, the brain, people who do that. Translations, I do beautifully. You get me to do translations of written word. I can sit there and I actually.
Well, there you go. We'll cut our costs in half right there. So, okay.
And I didn't.
What else can you do?
And to that point, I totally agree with, I think it was Councilor Beta Stuvey, who asked about the compensation for that added task, because it is a big task. This is very important to me too. As Councilor Bencomo, I wasn't speaking English till I was 8 years old, and my father was fluent enough, and my mother, I guess, to an extent. But at home, we only spoke Spanish. But my question to Joe is, if it's hard law pursuant to the Civil Rights Act of 1964. Why doesn't the city already have something like this? Is this what we're doing today driven by the fact that it's contingent on getting some funding for something else? Or I'm baffled by that.
Mayor and Councilors, Joe Richards for the record. We have had plans in place. I'm not sure how long they've existed, but I can tell you as a city, we were required to have a plan in place in order to obtain any federal aid. So like grant funding or other services. But in years past, the departments that had that funding had developed their own plans, but once a plan is established, it can be utilized by the entire organization. So if there was a need for that service, those plans could be utilized. Again, a recommendation came forward a couple of years ago that said, you know, as an organization, you should have something more universal that can be implemented and staff can be trained on, so that we're complying universally with one set of policy, if you will, as well as providing the same types of services. And those are the services that, again, Gail has researched that we've obtained in order to offer to all the departments to use.
Yeah. So, well, if I guess I'm not following this very well, Ms. Richards, so please bear with me. So if the plans in place for grant funding existed in other departments or parts of the city, am I correct in saying that so far?
Yes, ma'am.
Okay. Then why do we need to do this at this point? I'm just trying to get at why we're doing it now, this way. For what purpose? What drives it?
The drive, excuse me, Mayor and Council, Joe Richards for the record. Again, there was a recommendation received a few years ago. I'm not sure if that came from some grant funding agencies, but it was received by HR. And at the time, Gail initiated efforts to develop the plan. A plan was developed, but it never got fully implemented or approved. So that's why we've circled back to that now and said, well, you know, we need to make some updates to this. We can expand on it and provide additional services that weren't identified before.
Wow. Okay. So as far as the employees who will be interpreting the oral language or translating the written document, are they trained in doing this? And is there going to be any training, any education, any testing, this?
Mayor and Council, Joe Richards for the record. We do have some positions that are identified as having a preference for bilingual skills. And typically when we hire for that, there is an assessment. And we do have some different assessments available that are utilized in other departments that get people certified, if you will, in their proficiency level. So my recommendation would be that we, utilize that same service going forward when individuals are identified to make sure that they have a certain proficiency level.
Excuse me 1 sec. Looks like Jennifer wants to jump in real quick. Councilor Flores.
Absolutely.
Thank you, Joe.
Thank you, Joe.
Yes, ma'am.
Good afternoon, Mayor and Council. I'm not familiar with this. I haven't seen the presentation or talked to anybody about this yet, but this is probably for Title VI, not Title VII. In Title VI, yes. There's an anti-discrimination for federally funded programs and activities, which usually include airport. I know that in a lot of our grants that we receive, we have to give assurances that we are complying with Title VI and the non-discrimination. So I imagine that this is why we are doing it. It probably is centered a lot around federally funded projects.
Okay. Yeah, and I understand. Thank you, Attorney Vega Brown. I understand that it's Title VI, not Title VII, but I was just wondering what was, making forced. It almost seems like we're being forced to do it. Otherwise, we're going to be in, in a place we don't want to be. So thank you so much for that. And then also what Councilor Abeyta-Stubbe brought up was about the American Sign Language. Well, what about sign language in other languages? Not just, and then the American Sign Language person would also have to be because sign language is not universal. That's why it's American Sign Language. So I'm just wondering how that would work.
Gail, can you address that?
Yes, I know that with Certified Language Internationals, they have, like I said, more than 200, 250 different languages. And I know they have American Sign Language. I'd have to look and go back and do some research to determine if they need sign language in a language other than American Sign Language, how that would work. So I don't have an answer for that question right now, but I can certainly find out.
That would be good to know, because I imagine there are people who, aren't able to speak for whatever reason and have to rely on sign language. So that would be good. Okay, those are, I want to thank my colleagues for the questions that they brought up. And thank you very much, Mrs. Stell and Ms. Richards. And thank you, Mr. Mayor.
Okay, thank you, Councillor. And thank you very much for the presentation, Joe and Debbie and Gail. So looking forward to some other good stuff. Thanks. Okay, so now we're going to go to that last item, 3.3, terms of the settlement between the city and the estate of Antonio Valenzuela. City Attorney Jennifer Vega Brown will lead the discussion.
Thank you, Mayor and Council. This is Jennifer Vega Brown, your City Attorney. I'm going to present a portion of a presentation. There's a lot of information involved in it, and we're going to have to kind of tag team between myself and Interim Chief Dominguez and Damian Martinez. There's a lot of detail. So if you have any questions, please feel free to interrupt and ask questions, and I'll back up if I need to.
Okay, Jennifer, before we begin, I got the impression, and I think it was, this is really more for the terms of the settlement, but I don't know why I thought I read where it looked like we were going to be discussing and possible different changes to policy, that's not what this was advertised for. So I just wanted to let the council members know, they're going to go over the terms of the settlement. Hold on to a lot of your, you can ask questions, hold on to a lot of your items. We'll have another work session later, and we'll discuss what possibilities we can change. But this one here was not advertised to discuss changes to the policy. This is strictly terms of the settlement and how that in the city of Las Cruces.
That's correct. Thank you, Mayor. I will share my screen. Are you able to see my screen?
Yes.
And let me see if I can make that better.
Where's Councilor Sword? Usually he says, what is it, F5 or F3?
F5, and I do rely on his, yes.
Yeah, F5.
Okay. I'm working from two different computers here, so bear with me. On July 17th, in 2020, the city entered into a settlement agreement in the case of the estate of Antonio Valenzuela and versus the city of Las Cruces. The settlement agreement requires the city to consider various policies for formal adoption by the Las Cruces Police Department. Many of the requirements that are contained in the agreement were already implemented prior to the incident in question. I want to go over the authority to create department policies because that's an important aspect of what we'll be doing. The authority to create the department policies comes from the municipal code and the charter. The charter, Article 4, Section 4.01, mandates that all organizational units are under the direction and supervision of the city manager. That allows the city manager to have authority to set policy as far as the inner policy for departments. Also, the Municipal Code Division 5 authorizes the city manager to determine the duties of all officers and employees of the city. In the city of Las Cruces, we have various levels of internal city policies. The first one is the city manager policies. We call them CMPs. The second is department standard operating procedures. And then we have LCPD and LCFD general orders. They're all about the same thing. They're all administrative rules that determine how the employees in each of those departments functions and accomplishes their duties and tasks. City manager policies, CMPs, were created many years ago. Currently, they're housed in CMP 1.0, which states that they provide supplemental personnel rules and regulations beyond those required by the city charter, the city code, and personnel rules. All of the CMPs in the city are vetted through the CMP committee, and recommendations are forwarded to the city manager. So whenever there's a need or for a rule to be addressed, it is addressed by the committee. The committee currently includes the city attorney and the assistant city managers and the HR director. Anytime that a recommendation is made to change a CMP, it requires notice to collective bargaining units. Each collective bargaining unit has a comment and an input period. And the city manager must approve all CMPs. The other policies that we talked about are department SOPs. These are also authorized by the Personnel Manual, Section 601. They require city manager approval, and they may require notice to collective bargaining units for comment and input. And finally, we have general orders. Those are vetted through department committees, and these are LCPD and LCFD. They are approved by the chief of police or the fire department chief, and they also may require notice to collective bargaining units for comment and input. We'll go through the settlement terms now. I'm going to turn this over to Damian Martinez, and then Chief Dominguez will have to add some comments because there's a lot of information that will be needed to add to it. So Damian, I will hand it over to you, and just let me know when you want me to switch slides.
Thank you, Ms. Vega Brown. Mr. Mayor, Council, thank you for having me. Let's start off with what the settlement provides.
Excuse me, Damian, I know we identified you, but can you, for the record, state your name and who you are and what you do, please?
I'm sorry, Mr. Mayor. My name is Damian Martinez. I'm an attorney with Minette Martinez Springer. I represented the city in the lawsuit filed by the estate of Valenzuela.
Thank you.
Thank you, Mr. Mayor. Let's talk about what the agreement between the parties does and doesn't do. The agreement between the parties does not require the city to change any formal policies. What the agreement requires is that the city needs to consider 8 possible policy changes, but the city is not bound to make any of those changes. As Ms. Vega Brown told you, changing a police policy goes through different levels and is handled at different levels. What the city council has to do is consider the different aspects of the agreement between the parties. And so the first one, there's eight things that the city council has to look at. So the first one is to adopt a policy that bans chokeholds. Chokeholds have never been authorized within the Las Cruces Police Department. What was authorized by the Las Cruces Police Department is a hold known as a vascular neck restraint. A chokehold blocks oxygen getting to the lungs. A vascular neck restraint is a type of move where you block blood going to the brain, and that causes you to essentially black out. Since the event that occurred involving Mr. Valenzuela, the then city police chief, Chief Gallagher, prohibited the use of the vascular neck restraint. So the settlement agreement asks for a policy banning all forms of chokeholds. City Police Department never allowed chokeholds. And if Chief Dominguez would like to add anything, now would be the time.
Good afternoon, Interim City Chief Miguel Dominguez for the record. So there was a special order placed by former Chief Gallagher on March 2nd of this year, specifically stating that the vascular neck restraint was no longer an accepted use of force. We have since updated our use of force policy, which is right now under legal review. And as part of that use of force policy, that prohibiting the vascular neck restraint will be specified in that use of force policy. So that's where we stand as far as that's concerned. And Damien is correct that we never authorize chokeholds as a department.
Next slide, please. So the second aspect of the settlement agreement requires the council to consider the adoption of a policy requiring officers intervene when they're aware of any unconstitutional uses of force by fellow officers. So here is what goes on when it comes to unconstitutional uses of force. The officers who work in the Las Cruces Police Department or work for any department are already obligated to intervene when they believe that a fellow officer is violating somebody's constitutional rights. That doesn't have to be in the policy. The Supreme Court of the United States has already established that. But there is a code of conduct within the city of Las Cruces, which allows a violation of this policy where an officer clearly violates someone's constitutional rights. That is grounds for termination, immediate termination. We also have to remember one thing. A violation of a constitutional right isn't something that we can always see on its face. What I mean by that is it is not always clear if a violation has occurred. The Supreme Court has numerous cases on what's a violation of constitutional right. The big thing the past year has been qualified immunity. And qualified immunity allows officers to their actions to be protected and not violations of constitutional rights. And the key is when you look at a constitutional right, the Supreme Court has said they get to determine what violations of constitutional rights are. And when I say the Supreme Court, it's the United States Supreme Court. And a violation of somebody's constitutional right is clearly established. And what the courts have done over the years is they look through a lens in use of force, and it's the Graham lens, and that's the test. And when they look at that test, part of that test is whether something's clearly established. Because a lot of these cases, a lot of these incidents where officers use force are fast moving. So what does that tell us? It's really hard to create a policy where you can connect all the dots. If this, then that. There used to be a use of force type of tool that was used. Most departments have gone away with it. And it had color codings, right? And it made people think that you needed to follow these steps to ensure, it's a continuum of force is what it was called, to ensure that the use of force was proper. Most departments have gone away from a continuum of force model and have based their use of force on Graham v. Connor. So while it is helpful to have a policy, let's remember the Supreme Court has already declared what the law is, and a violation of a policy is not tantamount to a violation of someone's constitutional rights.
Okay.
Chief Dominguez.
Interim Chief Dominguez for the record. So as we're talking about the duty to intercede, Damien's correct. We already had it covered in our code of conduct policy prior prior to the incident that we're talking about, the new use of force policy, which I spoke about during the 8 Can't Wait City Council session a few months ago, would have a duty to intercede portion in that policy. Again, that policy is in legal review, but it is, we did specify that officers have a duty to intercede and identify the case law that requires it. So it is in the new use of force policy. So just moving forward, know that policy is very close to being put into place.
So the third part of the proposed policies that the city needs to consider is a policy requiring an annual or at a minimum biannual de-escalation training for every law enforcement officer in the city. This was already part of city policy, and city policy as it relates to officer training is based on the New Mexico Law Enforcement Academy. The City of Las Cruces has followed those guidelines and continues to follow those guidelines. You know, earlier we were talking about in the first presentation with the fire chief about the CIT units and the training that is available and that is done with the officers. City of Las Cruces has been out there doing this type of training for a while now, as was pointed out, and I would have the chief comment on any internal aspects that I've missed.
Before I get to the chief, Damian, Councilor Vasquez has a comment. I don't know if it's on this or if it was the one that just passed. Councilor Vasquez?
Thank you, Mayor. And this question may be premature, so if it's better for the end of the session here, that's fine. But I'm just wondering, in terms of the terms of this agreement, assuming that lawyers or attorneys looked at our policy, I'm seeing these first 3 policy asks, and they apparently are already policy. So I'm just wondering, why did the attorneys for the Valenzuela estate not do their due diligence, or are they talking about other things that we need to change? Because I'm hearing that we've already implemented these things, or they were already implemented. So I'm just wondering if you could comment on that.
Councilor Vasquez, thank you for that question. You know, I can't really comment on what Mr. Bregman did with respect to presenting and preparing his case. Sam Bregman's a very good attorney. He's well respected. What I can tell you with respect to the terms that are within this release, I've represented the City Police Department for almost 16 years now. The City of Las Cruces has taken police and police use of force seriously. Now, the City of Las Cruces was one of the first departments in the state of New Mexico, and probably in the country, to adopt an internal policy within the City of Las Cruces. Now, this was, technology has changed and changes in leaps and bounds on a daily basis, it seems like. And as 2020 has pointed out, but the City of Las Cruces Police Department was really at the forefront of requiring recordings. And at the time, it was what they used to call belt tapes, which were, I don't even know if they were digital. They might have been, magnetic tape, but would require recordings of police interactions with individuals in the city. Of course, it was during certain types of interactions. It usually related to domestic disturbances. But the City of Las Cruces was at the forefront of those changes within their policy back in 2007, I want to say. And that was in relation to a police use of force shooting that occurred in 2006. So I can't comment on what Mr. Bregman said. What I can tell you is in dealing with use of force cases that have come up over the years, the City of Las Cruces' policy as it relates to the police department has always been at the forefront of changes in law enforcement. And when I say at the forefront of changes of law enforcement, when other departments were still using the use of force continuum, the Las Cruces Police Department chose, it wasn't required by anybody, but chose to move from the use of force continuum to a constitutional matter under Graham v. Connor. So I can't explain why Sam asked for these. You know, these are 8 terms that we're going to go through that really are born out of what has happened in police interaction with individuals in this year. These are the same 8 terms that have been asked for in different states involving high-profile cases of use of force.
Okay, thank you, Damien. I appreciate it, and thank you, Mayor. I was wondering about that, and just thinking about, you know, if we are interpreting these to fit within the policies we've already established, or if Mr. Bregman and his clients actually meant something different by them. Because like I said, I mean, it would seem not to be too productive to have included in the settlement things we're already doing. But I will just save my questions for later on that. Thank you, Mayor, and thank you, Dave.
Thank you, Councilor. And that was a good question. And I will tell you, I was around when we had the continuum use of force, and I'm glad we moved away from that, because it was really huge challenges. Mayor Pro Tem, you have a comment or question?
I do, Mayor. It was sort of along the lines of Councilor Vasquez's, but so I've heard, and as you know, I have appreciated the leadership, right, of LCPD being the front runner, the trailblazers, as you might call it, as it relates to a lot of these. And I continue to hear that all these policies are in place, but I can't help but to think, then why are we in the predicament that we're in currently, right? What needs to happen? And as you know, and we've said this publicly, we have a public safety committee that we haven't got ramped up, but we have you and I, Councilor Vasquez, sit on a community mitigation committee that meets every couple of weeks. We've talked a lot about our policies being transparent. You see the transparency page on LCPD that's been created. We are talking a lot about the trainings that are available, the caliber of training with resumes. But I guess I'm concerned that although we are the leaders, if you will, trailblazers, and then we have this, and this has been very costly to us. So I guess I want to be assured that we have some assessments about our supervision and kind of a plan of action moving forward related to how we're going to handle this.
Yeah, Mayor Pro Tem, I don't think this is really appropriate for us to discuss anything in particular regarding this. I think it's just strictly go over the policies, have your comments. I'll be more than happy to share with you in private my take on what you have to say, but I can assure you that the city has always worked to do the best that they can, and you know, I think I mentioned before you the 4 newest council members. There was a time where we were just the claims against the city were so minimal or even the amounts that we paid, that I just knew that it was going to come back and swing the other way, and things seem to even out. But if I may, with all due respect, follow up with you on that personally. Okay, Damon, you want to go ahead or who is finishing up the other portion of this?
I'd just like to point out, you're not going to get every slide that says city and police department's already done this, we're doing it. You know, we're on slide 10, section request C. So we're gonna move through, the council will be able to see some issues that are out there. So the next slide that we're dealing with is the request that the city adopt a policy requiring annual or at a minimum biannual de-escalation training for every law enforcement officer of the city. So what the city is doing here is the city's going to run some scenarios in 2021 with, training to try to build up the training that the officers already have. The city of Las Cruces Police Department is already going to bring in reality-based training that will address this aspect of the settlement agreement. And Chief Dominguez, if you could add to that.
Sure, Interim Chief Dominguez for the record. So there's a request that we look at de-escalation training annually or biannually, as well as racial bias training. So we do several trainings on these two topics, and I actually have our academy director online right now that can speak more to that. This is Lieutenant Jeremy Story.
Good evening, Mayor, Council, Lieutenant Jeremy Story, the LCD Director. I'll speak to de-escalation training first. We see it as a multifaceted approach. De-escalation in and of itself is one of those words that can be very simple, but it's also nuanced. So I think in its simplest terms, it's communication and it's emotional intelligence, the ability to handle stress at an appropriate level without overreacting based on the circumstances. So we talked earlier about several of the things we already academy and as well as in service. So the New Mexico Department of Public Safety Law Enforcement Academy through the INMAC requires 2 hours every 2 years of dealing with the mentally ill, which is a big part of de-escalation. Our department has 8 hours.
It's really hard to hear.
I apologize.
Here, there's a lot of feedback, Mayor.
Yes. Is there another computer you can use, or is there just a lot of feedback where you're at?
No, it's pretty quiet in here. I'm not sure where that's coming
now
from.
it sounds real clear.
Okay, yeah. I apologize. Were you able to hear what I said initially, or
If you want to repeat again, it probably wouldn't hurt, please.
Okay. In its simplest terms, de-escalation is communication and emotional intelligence, or the ability to handle stress at an appropriate level. And so what New Mexico requires for in-service every 2 years is 2 hours of crisis intervention, and we currently provide 8 hours. But in addition to that, some of the things that we've done to look at how we can improve that, because 8 hours every 2 years, I think most of us would agree is probably not enough. We started to look at how do we actually incorporate de-escalation and make it part of the culture, and also make it so that it can be applied under stress. And so that's when Mr. Martinez started talking about the scenarios we have planned for next year, which is what we call reality-based training or force-on-force training, high-stress training that allows officers to practice these skills and be successful at them while under stress. Those are very effective for teaching a skill and then allowing that skill to be used under stress and recalled. The other things we're looking at, the council approved the Axon contract, which as part of that is the Axon VR empathy training. It allows officers to not only experience what certain conditions may be like, but also to see it from the other end and to successfully de-escalate those while in kind of a virtual reality environment. So that will be a part of the training. I think that's going to be very effective for building empathy, but just awareness. When officers have better awareness of different conditions, they're able to handle those situations a lot better. Another thing we're looking at is a video trainer system, which allows us to go through dozens or potentially hundreds over a year period of scenarios that deal with people with different circumstances, different disorders or crisis, and successfully de-escalate those. And the amount of times they do these increases their chances of success on the streets. For this year with COVID, unfortunately, our in-person training has been reduced, but one of the things that officers did do this year is an online course through Target Solutions, which is the city's learning management system, called the Essential Components of De-Escalation and Conflict Resolution, which is the first in a 3-part series. They'll complete the other 2 parts next year. But essentially it's communication skills and how to apply those skills to successfully resolve conflict. And I think this approach where you have it in the classroom or academic setting and scenario-based setting is the best way to try to increase our success in the future. And obviously we're all human. We can only do the best we can, but I think it's a good approach going forward.
Very good. Thank you. Okay, Damien, you want to move on to the next one? Hello, Damien.
I'm sorry, that's Zoom. I was on mute. My apologies. This next section is the part of the settlement agreement requesting that the city adopt an annual or at a minimum biannual training on empathy and racial bias for every law enforcement officer in the city. As Lieutenant Story told you, with the Axon contract, that's going to be included with scenarios. And also bias training was implemented by the city, requiring everyone to complete that bias training by the 20th of November. So a few days ago, last Friday.
Damien, I do know that, and the chief can correct me on this, but I know the officers in part of the academy, they also do sensitivity training or some type of training like that, but I'm pretty sure it's called sensitivity training for, how to deal with members of the public. So I saw the bias training, but I thought that sensitivity training also kind of veered a little bit towards that bias training as well. Wasn't too sure, but I'm pretty, I know the instructor for the last several years, and he's pretty well versed in that. So,
Mayor, I can answer that. Lieutenant Jeremy Story,
yes,
Mayor Council. What you're referring to is cultural awareness, which is a part of the academy, but they also receive training in a number of areas that kind of are in this realm in the academy, to include dealing with the hard of hearing. Autism awareness will be a part of this academy. Of course, they do the 48 hours of crisis intervention in the academy. They'll also receive duty to intervene in the academy. So there's a lot of areas that kind of touch on this in the academy.
Okay, thanks. Councilor Vasquez, did you have a question or comment, or did you forget to put your hand down from last time? I didn't.
I forgot to put my hand down. Thank you, Mayor.
Okay. Councilor Flores, you? Do you have a question?
I have a question at this point, and perhaps Lieutenant Story can answer it, maybe Damien. But in terms of the racial, I'm talking about the substantive aspect of racial bias training. We have a lot of our officers, I believe, are Hispanics or Mexican American or whatever. I don't know if they are or not. But there's also, so I'm just wondering about the kind of, quote, racial bias training, unquote, we're talking about. Is it an awareness that perhaps racism or racism is so institutionalized that perhaps a Hispanic, and because that phenomena does exist, where there's this self-hate. So that self-hate is projected, even though that onto another person who is of a Hispanic, Mexican, or another racial minority. Of course, we're in the majority, but I mean, in terms of sociological speech. So is that taken into account in the training, or the substantive aspect, Lieutenant Story? Are you familiar with it, or are you, Mr. Martinez, familiar with that aspect? Because a lot of that goes on.
I think I can answer that.
I'm just saying, just sociologically speaking. I'm not speaking specifically, but in terms of really raising consciousness and knowing who we are. Okay.
Yeah, I'll try to answer. Lieutenant Jeremy Story, Mayor, Councilor Flores, the training that we've had several implicit bias trainings, or what we call fair and impartial policing training over the years. And that's one thing that they have addressed, maybe not as direct as you bring it up. The last one earlier this year, we did, again, through Target Solutions, Caliber Press implicit bias training. But we also brought in a company called Fair and Impartial Policing, which is...
I'm sorry, it was called what?
Fair and Impartial Policing is the name of the company.
Okay.
Started by a PhD, Dr. Fidel. And it's become, there's other companies out there, but it's become definitely one of the main companies in the country. Mm-hmm. And we brought them in to certify 8 instructors in fair and impartial policing. And the main tenet of that program is recognizing the science of bias, helping officers to recognize that all human beings have biases. Some are good, some can affect our judgment in a negative way. And then learning ways to either get rid of those biases or mitigate their effects. And so that would include the specific one that you brought up.
Great. Thank you so much, Lieutenant Story. I appreciate that. Thank you, Mr. Mayor.
Yeah, thank you. Councilor Bencomo?
Thanks, Mayor. Thanks, Lieutenant Story. I wondered, so you might have answered that question just now, but I wondered who does the implicit bias training. For example, the one that had to be done by 11/20.
So that one actually, all the officers completed that by early July. That is done by a company called Caliber Press, which is a nationally recognized training company. And that was through our learning management system. The ones going forward, since we just brought in this company specifically to certified officers with their program, and it's their program that has to be taught, that will be the company that we use for at least the next 2 years. It's a 2-year period. And so that's actually literally the name of the company is Fair and Impartial Policing.
Okay, and you said Caliber Press?
Caliber Press is the name of the company for the one earlier this year.
And
we also did the de-escalation training.
How long was that training?
The Caliber Press training is a 4-hour training.
Okay.
But it is online, so it depends on how fast the officer can successfully negotiate the course.
Okay. And so this is these 4-hour trainings on racial bias are happening how often?
So the plan going forward, that was for this year because of COVID and the difficulty with in-person. The plan going forward is that it will be an 8-hour training. Our policy requires that the training that the training is yearly or annually. So this program is meant to be an 8-hour program every year.
Okay. Thank you, Lieutenant.
Yes, ma'am.
Thank you. Okay, Damien.
The next section of the settlement agreement relates to investigations of use of force that officers are alleged to have engaged in. Here's what we can tell you about use of force policy and investigations within the city of Las Cruces. The city of Las Cruces already investigates, the police department already investigates use of force. Every use of force. And when I say every use of force, if somebody says they've been handcuffed, that the handcuffs were too tight, that use of force is investigated. Now, the Internal Affairs Professional Responsibility Division of the Las Cruces City Police Department is the entity that engages in the use of force investigation. They maintain those records. My understanding is the police department is going to change their policy slightly to match the Retention of Public Records Act, which requires 3 years to retain those use of force records 3 years after separation by the officer. Now, the other thing that the Las Cruces City Police Department does is when there is a lethal force that involves a death and the police officers involved, there's a multi-agency task force that investigates that. That's important. That's important because there's oversight over the Las Cruces Police Department. It's not one of these I'm watching after my boy type of stuff. It's the state police is involved. The Sheriff's Department's involved, I believe. The New Mexico State University Police Department's involved, and they do the investigation to that use of force where a death occurs. So that is already done. That's been done for years. That's really important. I don't know other agencies in the state who have a multi-agency task force like that. Again, if there is a use of force that another officer, this gets back to one of the earlier slides about intervening in an unconstitutional use of force. If an officer sees or a witness sees a use of non-deadly force, that'll be reported to the Las Cruces Police Department. That will be investigated. I will defer to Chief Dominguez and Lieutenant Story to fill in any holes that I've left.
Interim Chief Miguel Dominguez, for the record, Mayor, City Council. Damien's correct. All uses of force are investigated, and even prior to an internal affairs investigation, it starts off at the supervisory level. So any use of force that occurs, there's a system that we call a blue team. It's a record management system for uses of force specifically. They have to submit that a use of force before their end of the duty day, and it immediately goes into the supervisor's queue for review. It starts as at that point, if a supervisor finds anything wrong with it or needs further review, he can or she can send it off to a use of force expert or instructor to look at the use of force, just to make sure that everything was done by the book. So more than just the internal affairs, we have several chains in that, or several links in that chain that have an opportunity to review the use of force, just to make sure that it is okay. By the time it gets to use of force or internal affairs, it's already been looked over 3 or 4 times, to include video reports, sometimes witness statements and the likes. And it's a very thorough process of reviewing.
And Chief, isn't that after that review, from the multi-agency task force, then that's presented to the district attorney for possible criminal charges, if any, and then they clear it if they find it was justified?
Mayor, you're correct on the lethal force. Absolutely, everything goes to the DA's office for their review and or investigation.
Okay, thanks.
Mr. Mayor, I would also like to note, in my time representing the city of Las Cruces, I've seen incidents in use of force where you get a use of force history on an officer, where initially the use of force was found to be within policy, but then the chief asks for a second look, and the initial use of force being in policy is reversed because they get a second set of eyes on it when the chief doesn't think that, that when the chief thinks it needs to be investigated in greater detail. And I've seen reports where the initial good use of force turns into a bad use of force, and discipline is doled out.
And Mayor and Council, this is Jennifer Vega Brown, your city attorney. I'd also like to just tell you that the retention policy is going to come before you sometime in January. Our records manager was already working on that. We updated our retention policy a while back to basically mirror the state, but we do have, because we're a home rule jurisdiction, we are allowed to have our own. So that will be updated, and it's already we're already working on it. You'll be seeing it in January sometime.
Okay, thank you. Okay, Damon. Yeah.
Mayor, I'm sorry. Can Chief Dominguez just talk about there is like a database or something, some kind of program that use of force goes in to? Is that true?
Mayor Pro Tem, Interim Chief Dominguez, for the record, that's correct. It's the database it's called Blue Team. It captures all uses of force, and that's a tool that our internal.
Thank you, Chief.
Yeah, we're having a little bit of a bad connection there with Chief Dominguez.
Yes.
Okay, Damon.
This next slide relates to the request of an adoption of a red flag warning system to track uses of force by officers. Pivoting back to what the chief said, there is what's called a concise history, which gives you the use of force that each officer has had since their employment as a police officer. But the city of Las Cruces since 2005 implemented an early intervention system. And as I previously said, all these use of forces are documented within any officer's records within the department. We have disclosed use of force, these concise histories on several cases. They're available in IPRA if somebody requests them. In short, the city tracks uses of forces and is able to determine whether or not somebody is one of these, red flag bad officers, somebody who uses unreasonable force. So that's already in place.
Very good. Okay. Mayor Pro Tem, you have a question?
I do. With Damien's statement, when he says the city tracks the use of force, who do you mean? Is it law enforcement? Is it our manager? And to include our city attorney like Jennifer Vega Brown? I mean, how is that, when you say tracked, what does that mean?
It's a database within the Las Cruces Police Department that tracks it. I cannot speak to whether or not it's something that is easily accessible by other employees of the city of Las Cruces. The chief's going to have to answer that one.
Mayor Pro Tem, they are all tracked, and their internal records on our end because they're personnel issues. So they are just held within the police department. And to the early intervention system that Damien was referring to, the red flag warning system, this system has been around since 2005. The software that I was talking about, the program, the Blue Team program, initiates. We put in several things to include citizen complaints, internal investigations, supervisory matters, vehicle pursuits, uses of force. There's several indicators that go in there, and they all have different parameters. For example, a use of force, if you had an officer had 2 or more uses of force within the same month, it initiates a red flag, and then the officer's supervisor immediately looks into it, has to schedule a meeting and go over the performance and just make sure everything is working the way it's supposed to in our policy.
Okay, thank you.
Chief, when you said that it's just kept there with the department, does Joe Richards and her HR department also have a copy?
Mayor, if it's requested from Human Resources, yes, sir, we usually provide a copy to them.
Okay, it looks like Councilor Vasquez, you have a question?
Thank you, Mayor. Yes. One, I thank you for that question. I mean, I think it might suit us to make that part of this policy, is just to send all of those directly to HR so that it goes through a different, just so it's housed somewhere else, so that I think the public maybe would like to know that it's not just the police that's holding these records, but other city departments. I think that might just add some confidence to this process. If we can incorporate it into this policy. The other thing is, around the police audit report. So I know when we got the reports back from our previous auditor, I think it was general sense of the council, especially last time, that we really like to know more than just a substantiated or unsubstantiated reports, because I think part of the solution to solving some of the issues we have around bad behavior when it exists is being able to see it early on. And so I don't know, other than the numbers of what, how many times use of force is reported, it would be great to know if it is a recurring report. Use of force recorded in a quarter for the 6th time against the same officer, to me, is different than use of force recorded for the 1st time against a veteran officer. I think those are important details to know that don't necessarily have to dive into the personnel issues or even the identification, of course, of anybody. But there's got to be some different ways that we can look at this data to start noticing trends around this particular, around the use of force. And I won't go into the details of why I think that's important, but recent events make me think that's very important for us to know that. And so I think figuring out how we can make the best use of these numbers to figure out trends is going to be useful in a way that's appropriate to not release any personnel information.
Yeah, no, very good.
Thank you, Mayor. Thank you, Chief.
Okay, Damien.
Thank you, Mr. Mayor. It's Damien Martinez again, and I think this slide will address some of Councilor Vasquez's concerns. As part of the release, there was a request to consider the adoption of a policy where the Las Cruces Police Department would report to the council on a 6-month period use of force incidents and discipline related to those use of force incidents. This was included in the previous, by the previous police auditor. This was done. A more detailed version of what the new police auditor will do is in the RFP. So I think this is one of those issues that is out there that is going to be addressed, and the city is planning to get this addressed through a new auditor.
Okay, very good.
Okay, request H is a request that would require officers to submit to a mental health exam on an annual basis, administered by a licensed psychiatrist who will certify a fitness for duty. So the department is currently implementing mental health support as part of their policy. But the requirement of a mental health exam for fitness for duty, there's different things that we have to look at here. You know, there's the ADA, the Americans with Disability Act. You know, if somebody has a disability, can the department provide an accommodation in that officer's job category to allow him to essentially meet his job qualifications. And the other thing is the collective bargaining agreement that the city currently has with its law enforcement union. Remember, Ms. Vega Brown told you or discussed early on in this meeting that there's various things that you have to look at in determining policy. And one's the collective bargaining agreement. Although it sounds, you know, something that's easy to accomplish, the collective bargaining agreement is a contract between the city and its police officers. So you just can't make a requirement to adopt mental health tests without going through the collective bargaining agreement. And I would, if Ms. Vega Brown has any comments or anyone from the department.
Yeah, Jennifer, I think with this you're going to make this recommendation that it go to get vetted through the public safety PRC. Was that what that means here at the bottom?
Thank you, Mayor and Council. This is Jennifer Vega Brown. Yes, in order for us to really discuss the implications for the possibility of this type of policy, there are many considerations. So I think it would be appropriate for it to be vetted through the Public Safety Select Committee to be with recommendations back to City Council.
Okay. Councilor Bencomo, Councilor Flores.
Thanks, Mayor. I have some questions, but I was obviously waiting till the end. We did this a little bit different than usual. So are we at the end of the presentation or
No,
not?
we're just going slide by slide because after we finish the slides, and that's it for the questions.
Okay, well, that was news to me. So I will ask all my questions then. Jennifer, since you're off mute, I'll ask you a couple questions. Earlier you went through the different kinds of policies, right? CMPs, SROs, general orders. Where in this sort of process does council policy recommendations fit?
Mayor and Council, this is Jennifer Vega Brown. There are no policy recommendations necessarily from Council. That's one of these things would be vetted through. That's why I suggested a public safety, the Public Safety Select Committee, so that when it comes to some of these, like the mental health, that is something that does not exist. An annual mental health evaluation, the way that it is outlined in the agreement, does not currently exist. So that would be something that we should vet through the select committee. The other types of policies are operational and administrative policies, which are already in place. Any of those changes can be made through recommendation to the chief or the city manager. they're not necessarily the kind of operating policies that you're talking about, like the standard operating procedures. Those are not policies per se. Those are more of administrative rules. That's how the city council lays out the policy of what they would like to achieve and how they want things to be. And the administrative rules determine how that occurs. And that's up to the city manager. That's why we have to be very careful in how we are establishing policy. You can set some of these things by ordinance, if that's the decision and the determination that you make. That certainly is something that should be vetted carefully for legal reasons.
Right. Okay. Yeah, I mean, I think, right, there's definitely something to be said about agencies, internal departments of the city, like LCPD, that are very outward facing, right, that have significant amount of their time, face time with the community, that I think require a different kind of sort of perspective in terms of policy making, right? So they're not just internal administrative, like they actually have a huge impact on the community. So I was curious about where some of those things fit. And then in terms of the items that need to go back to the collective bargaining agreement, you said for comment and input. What happens in the event that council moves forward with a recommendation like this, like a mental health screening, and the folks in charge of collective bargaining say, no, we don't want that? Like, what happens then?
Mayor and council, this is Jennifer Vega Brown. You would have to follow the process for negotiation. So that would be included in initial negotiation, and the collective bargaining units would negotiate that with management. If it came to an impasse, then there are policies and processes for how an impasse is handled, and that eventually would end up in a binding arbitration, or could end up in court. One of the things you have to consider is that our city charter outlines that the city council cannot get involved in administrative matters, and so there could be some gray area there. This is something like this would be new to have as a resolution or an ordinance. There are ways to communicate your desire to have a certain policy. There are ways to communicate that and to make sure that that gets implemented. I don't know if it has to be done in a collective bargaining agreement, but we would have to explore.
Okay, thank you for that. I mean, I think what I find interesting about this presentation is that most of the things, if not all of them except for this last one, you said that we have, right? And so what I'm hearing from the presentation is that we're good. Like, this is great. The problem with that is that that's not what I hear as a city councilor, right, from the community. It's not what I see from the community. I think we have to be really serious, right, about the kind of tension that exists right now in our community, and how do we address that? And so to me, some of these things that were presented today are the floor. Like, they are the floor. They're the bare minimum of what equitable, fair, and just police departments should be, right? So what are we doing as a city, collectively as a community, to raise the bar, right? To have to ensure that police community relations are in a healthy place, in a good place, right? And I mean, we just finished talking about the lack of capacity, the lack of resources for social workers in the mobile health unit, right? Like, I'd rather use $6.5 million to hire more social workers than settlements. And so I want us to have a conversation, like a hard, courageous conversation about how we're raising the floor on some of these things. And, Mayor, you said that today was not the time for some of that. I'd like to know when it is. I'd like to have a firm date about when we're going to have some of those conversations, and be serious to the level of accountability that the community is asking of us.
Yeah, well, thank you, Counselor. I'd be more than happy to have set up a meeting with the chief, yourself, the city attorney, and myself. And you're saying that that's what you hear. Well, yes, you get elected by the people of your district to make decisions on their behalf, but then also we hope, disseminate the information that's correct. Earlier I saw someone emailed me saying that when those two grocery stores closed down, that represented 1/3 of all of our grocery stores. Well, it didn't. So I guess what I'm trying to say is, we know what happened. We know what the real truth is, and so it's a matter of, do you take that and disclose that to your constituents and say, hey, listen, you know what? I'm sorry, I know you think this, but this is how it really happened. But anyways, getting back to your original question, be more than happy to have that discussion with you, and sure, and that way there you can, because there are things here that I think that you well-meaning, but can put unfairly the city and the department at risk. So I would just appreciate if you would, and be more than happy to also include Mayor Pro Tem Gandara, because I know she wanted to talk about a few things as well.
Mayor, I think the important thing about this in conversation, though, is that it shouldn't happen in a closed room with 4 people. Like, this is a conversation that should be had with the community, right? And the community listening. And yes, I hear you, Mayor. There's a lot of misinformation. This year has proven that beyond, right? There's a ton of misinformation. But I'm also, I've been here 11 months, and I also sit in closed sessions, and I also hear what's happening. There's also Washington Post study that says Las Cruces had a pretty troubling rate of police shootings between 2015 and 2019. So, you can't just tell me that I need to be better, filter information better. When I do my research, I don't come here and say things that are baseless, right? I come here and ask questions and present ideas and thoughts about things that I know are important. And so, I appreciate that we should have a public conversation about some of these issues.
Yeah, and I appreciate that, Councilor Bencomo, but what I don't want to see is a future lawyer, when they're suing the city, having a snippet of you saying something that is wrong. I'm sorry, I'll be real candid with you. Remember, I served prior to this as, for 3 years, we settled nothing but law enforcement claims. And I'm telling you, I've seen that happen. Someone will innocently say something that's not true. That's why I'm not saying that this is behind closed doors. I just want the attorneys to tell you, you know what, that's just not right. That can't be done. And if it does, this is where it could affect us. So although on one hand, you do represent your constituents, the other, we also hope that you protect the city resources as well. Saying something that's right. And I'm not saying, and then after was disclosed or discussed with you, and you still choose to say, hey, we can't stop you. But if we say, if you say there are certain things that I think that need to be discussed, and sure, I have no problem in having a work session to discuss various policies. But as was mentioned by Jennifer, there are certain things that we can try to do, but we also ultimately have to listen to our legal counsel, because if we try to go above that, then are we doing the same thing that you're trying to avoid?
I mean, I think Mayor, this is definitely about both protecting city resources and protecting city residents as well.
And I'll admit, I was talking to someone the other day. I've been with the city so long that I think of our police officers as my sons and daughters. I'm old enough to be probably their dad. And it's like, hey, you know what? Our guys don't do anything wrong. It's your guys. It's your department that does. But I know once in a while our people will mess up. But the fact of the remains is they put their lives on the line for us every day. Every day. I mean, the stuff they deal with. Mayor, I know you know that. I know you know that. I know you understand that. But all I'm just asking is that we have that meeting so we can share some issues. And if you still choose to discuss them, great. That's all I'm asking.
I think it's really unfair, Mayor, for you to make a correlation between the people who want accountability between not realizing and respecting the kind of sacrifice that our law enforcement those two things are not related. I absolutely have respect and gratitude towards our law enforcement agents. This isn't what that's about. Your accountability and my accountability come every 4 years. People will choose, they will decide whether they want to keep us around or not. It is then our duty within those 4 years that there is accountability everywhere else. And that's what people are asking us to do. It is not a hard lift. It's about accountability and people wanting to feel safe. I think you want to feel safe in your community. I want to feel safe in my community, and we should all have that. And we should work towards that.
I hear you, and with all due respect, the emails I got was that we conform to the 8 can't wait. And I think it's fair to say that other than maybe one item, we were there. So, but again, I'm just merely asking you as a consideration, and then also to allow this to go to the Public Safety Committee. You know, earlier when we'll propose something, you'll hear one of the council members or two of them say, hey, you know what? That's what the PRC is for. Let's follow procedure. Yeah, and it's kind of hard. I forget that we have the PRCs, but that's what was disclosed. That's why they were made, and I think that's what we should follow procedure. Councilor Flores.
Thank you, Mr. Mayor. So going to the H, adopt a policy requiring officers to submit to mental health. And I agree with, or I think that either, I can't even think very well now, we've been here over 6 hours, 5 hours, but it was either Attorney Martinez or Attorney Vega Brown who said that that might be a hurdle that can't be overcome because there may be ADA violations, and the collective bargaining agreement would have terms that would agree to that, and then, you know, that might create some, but, you know, I don't know, I know that I've maybe brought it up in one of our meetings, but I don't see it so much as, you know, a quote mental health exam, unquote, to assess fitness for the job. I see it more of a, you know, like the that simulated training that we went through, but we experienced, you know, to see how fast you pull out a gun and what you do when someone is pulled over and you're the cop. Remember that, Mayor Megashima?
Yeah, I know. I think you got injured. I think you got injured.
No, I was dead. You're the only one who survived that damn thing. But anyway, you know, it's that trigger, for lack of a better word, the trigger, what is it, trigger happy or trigger whatever. But, and I'm not sure it's a cycle. I'm not sure it's a quote mental health unquote issue. I think it's something that can be seen insofar as a police officer or a potential police officer or applicant responds to a certain situation, or if it's already a police officer, I guess this is assuming these are already police officers, and for all of them to submit on an annual basis. Okay, so the test wouldn't have to be psychological. I think there could be another way of assessing whether an officer doesn't have that trigger happy, that's what it's called, trigger happy finger or whatever, where, you know, the person just seems to be nervous. I don't think that the person I don't think a person has to have a diagnosis to determine that, you know, the person is just like a nervous person that does that. And there are people like that. You know, there are people that sometimes you're standing behind them in light before COVID, and you move a little bit and all of a sudden they turn around like they're being attacked. So there's just, you know, personalities like that. So it'd be more like a personality thing, because I really think that the way some officers have behaved or have, you know, just because of the different cities I've lived in, major cities, Los Angeles, San Francisco, Sacramento, issues like this come up. And invariably, it's not the it's not the way most officers behave. And that's what we have here too. It's like one rotten apple is spoiling the barrel. So I think that if that language could be changed and really tailored to really say something what you mean, because I don't think, to submit to a mental health exam on an annual basis, I think that's harsh. I think it's unrealistic. I think that someone may be in mental health care already. It may be under the care of a psychiatrist or a psychologist, maybe receiving medication. And so all of that, I think, triggers too many issues, but I think that there's a different way of getting around that. And I just wanted to share that, Mr. Mayor. Thank you very much. And thank you, Mr. Freeman.
Thank you, Counselor. I think the chief wanted to jump in real quick and make a comment or two. Chief Dominguez?
Mayor and Councilor Flores, I just wanted to talk about this, the mental health thing. So I just wanted everybody to know that we do have a psychiatrist that any traumatic incident or whatever, he does debrief our officers. It's voluntary, obviously, but he's available, and several of our officers actually go to him and on their own, and they don't have to talk to us about it. They seek his guidance. But as part of our wellness program, we're trying to expand on that. So, and there's going to be the opportunity for our officers to get more mental health and physical health as well. There's a lot that goes on, and the mayor keyed in on it a little while ago with a lot of the traumatic incidents that these officers go through. Some that I don't even want to talk about, but there's a lot of PTSD that happens amongst officers. Suicides are at a huge increase right now nationwide. And we want to take care of our officers. That's ultimately, we want to make sure that they're doing okay, not just physically, not just lifting weights or running, but mentally as well. So we've invested in this app that's part of our wellness program to deal with depression and anger issues, PTSD, family support. There's a lot of divorces and things like that happen with officers because you change as an officer, and I won't go into it any further than that, but you need that, and you need the peer support. So we do feel for our officers, and we are doing everything that we can to make sure that they have an outlet. So just to say, I just wanted to say that because the mental exam, the issue is mandating it, but it is available already. Thank you.
Thanks, Chief. Let me ask you a question. Do officers have to have your annual physical? Or is that not required?
They do not.
Okay. Councilor Abeyta-Stube.
Thank you, Mayor. Chief Dominguez, when officers first go into the program, I suspect that they do have to go through a psychological exam, correct?
Councilor Abeyta-Stube, that's correct.
Okay. And as you just described, officers are really put in very unique situations, tragic situations, terrifying situations, and that can lead up to different types of issues, including depression, PTSD, those types of items. And, it doesn't even have to be one major event. It can be the sum of a lot of smaller events. And I would say, especially for officers that are veteran officers. With that in mind, is there any point, even a 5-10 year time periods, that officers are reevaluated because the person that they are when they go into the program isn't necessarily their experiences, their life, their changes, everything's going to be different, in the future. And so are there any points where they are re-given these evaluations that they were given at the beginning of their time at the force?
Mayor, Councilor Beitasu, there is not, but we try to use our tools like the early intervention system to give us indicators of some sort of issue or some sort of trauma that they're going through. There's more than just uses of force that are keyed in by the early intervention system. We're also talking about absenteeism, not going to court, being tardy, being very like having a supervisory matter where the supervisor had to go and talk to you because you've been withdrawn. So these indicators, that's what we use to try to get them to the services they need. Without being specific, there is times as a supervisor where I brought in our psychiatrist and told him I have an officer that needs your help, and he stepped in several times actually, and it worked out. He was able to provide that. But no, to answer your question, there isn't a time frame where they have to get reevaluated mentally.
And even if the psychiatrist you bring in, it is still all voluntary, is that correct? The person at any point can, even if you think that there's a problem, it is still a voluntary issue or not?
Mayor, Councilor Beitasu, that's correct. The psychiatrist will let us know, notify us if there are any issues where we need to step in and take actions, personnel action, and it's happened before. So if it does occur and there is enough red flags there for a licensed psychiatrist to determine that, then we will step in.
And they can determine that if somebody has refused service?
Mayor, Councilor Beitasu, no, to your point, again, it's all voluntary, unless it's a critical incident, then they will debrief, but what they disclose to the psychiatrist is up to them.
And they are mandated then, if it is one of those critical incidences, to see the psychiatrist, or is that still voluntary?
Mayor, Councilor Beitasu, it's still voluntary. The debrief is voluntary, but we do make it where they go there, and if they do not want to share anything, that's up to them.
So if there is truly if somebody knows this system, then there is, unless it is mandated, there is a potential for an issue to be missed because they can refuse service.
Mayor, Councilor Beitasu, of course, there's always a way around things. That's why we try to put as many tools together as possible. Again, this EIS system works very, very well, and we key in on these EISs weekly or daily sometimes with different officers because of the different indicators and parameters that are set.
Okay, thank you. Thank you, Mayor.
Mayor, if I may.
Yes, Jennifer.
This is Jennifer Vega-Brown, the city attorney. There is a mechanism for a fitness for duty process that is contained in the general orders. It's also contained in our personnel rules. I would have to refresh my memory on the collective bargaining agreement, but I'm pretty sure that the collective bargaining agreement refers to the personnel rules. So if there is an identified issue by a supervisor, of course, there are many legalities involved in that, reasonable suspicion, probable cause, other things like that. But if there is an identified issue, there is a fitness for duty process for an evaluation.
Okay, very good. All right, Damon? Oh, Chief, you had another question, or did you forget to put your hand down?
My apologies, Mayor, I forgot to put it down.
Oh, no problem. Damien?
I believe the following slides are training requirements for the LCPD. I believe Lieutenant Story is probably the best person to discuss these.
Okay.
Lieutenant Jeremy Story, Mayor and Council, these are just the NMAC requirements. So this is what's the required training for all law enforcement in the state of New Mexico. This is literally the bare minimum training. We exceed all of these, and then we add our own as well to it.
Okay. You want to talk a little bit of what you add more to it, or you're welcome to, let's put it that way.
So some of these are annual requirements. Things like ensuring child safety is just essentially ensuring that if a person is arrested, that we make sure that, one, we check if they have children, and two, if they have children, that those children are safe and they have somewhere to go to. There's specific procedures for who to contact and how to vet that person. Obviously, firearms training. There's mandated firearms training, child abuse training. I think a lot of these are just kind of hitting all areas, not necessarily specifically the areas in that were addressed here, except for the 2 hours in interacting with persons with mental impairments, which is the House Bill 93 training. And again, that's 2 hours every 2 years. We do a minimum of 8 hours specifically on that topic. And then there's other things that complement that. So again, this is what's required in the New Mexico Administrative Code.
Okay.
That slide, that's a flyer for the company that came in to do the fair and impartial policing or the implicit bias training, just for reference if the council or the mayor wanted to see it, I guess.
Okay. Very good. Well, we kind of, I'm going to open up to Councilor, well, if I may, Councilor Bencomo, Councilor Vasquez, because he was going to wait till the end of the meeting, and he's the one that I had, but then everybody seemed to be asking questions. So let me ask Councilor Vasquez if he has any questions. If not, I'll go to you, Councilor Bencomo, after him. Councilor Vasquez, did you have anything you wanted to say?
Sure. Thank you, Mayor. And I'll be quick. I know Councilor Bencomo has some comments, but I think this is a good start to the transparent process. I think of where we really need to move forward with discussions in our community about police reform and about accountability, and really giving all of our residents the confidence that they, are being served and that their best interests are at heart when it comes to public safety in our community. I think historically a lot of communities have felt that they've been targets, unfairly targeted by police for many different reasons. Certainly the color of their skin, certainly the place where they live, their income level, car that they're driving, any variety of things. I mean, I grew up, with folks with plenty of stories about, being dead scared of getting pulled over, or, just the fear of police. And I'm not saying that that's happening here. I'm just saying that those are real sentiments that people have. Those are the people really feel that way. And so I think being transparent and talking and having these conversations with our community about what our police is doing, like I said, even with those police during the audit process, when we get those numbers back, really explaining any trends that we're seeing, or explaining what we're doing to be better, and taking citizen complaints seriously is going to be an important part of that process on those updates that we get from our new auditor. So I do welcome the opportunity to have a more robust discussion. Obviously with COVID, it just limited our public participation, but I think I can imagine maybe even a town hall format type of discussion in the future. It doesn't have to be a work session format even, but something public that we can have an engaged dialogue with different members of our community and our city representatives or administration and police there, so that we can all continue to have dialogue on this in a way that that is open, that's transparent, and that really lets folks know that we care about everybody's experience in this community, or even in other communities where they may have faced some trauma for many different reasons. And so I'll just say that, regarding this particular settlement, well, I think this is a good example of where we don't want to end up in the future. Right. And the lesson learned for me here is like, even if we have things in place that are meant to prevent these types of things from happening, they may happen sometimes, but it's always good to do more. It's always good to try harder. It's always good to try to do better. So I'll leave it at that. Thank you, Mayor. Appreciate it. And thank you, Damien and Chief. Thank you.
Thanks, Councilor. Councilor Bencomo.
Thank you. I actually just had a quick question on that last slide that you showed, Lieutenant Story, and you don't have to put it up or anything. I just, you mentioned there was a train the trainer, implicit bias type of training. Who are the trainees, or is it other officers being trained?
Yeah, so Lieutenant Jeremy Story, Mr. Mayor, Councilor Bencomo, that training is geared towards certifying law enforcement officers to teach the curriculum. So we had 8 from our agency. You had other agencies there. We had the most, we hosted the class, but we had a variety of different officers, sergeants, and lieutenants that attended. They have other classes. Go ahead, ma'am.
Okay. I'm curious what was the decision to do that kind of model where officers are doing then training on implicit bias rather than have, professional, like people who, this is their profession, do the trainings instead?
Mayor, Councilor Bencomo, the reasoning behind that's the model that's being used by hundreds of departments across the country now. And I think the reasoning is twofold. One, the program itself is very much vetted in both science and it's constructed by professionals. And I went through the course myself. It's a great course. I think it opens a lot of people's eyes. And officers are more likely to hopefully hear something that another officer has to say and internalize it. And I think it's easier to change the culture when that happens. That being said, that's why it's only 2 years, because there has to be mechanisms in place to make sure that we are keeping the spirit of the curriculum. There are other programs they offer. One of them is a command and community, which is a 1.5-day course for command staff, community members, and elected officials. And so I think all of those are probably important, but the rationale is that it's easier for officers to hear from another officer, at least initially. And that's pretty much it.
Okay, thanks, Lieutenant. Yeah, I mean, I hear you, right? The messenger is sometimes the make it or break it. I think I also want to make sure that that information is being, given by very well-trained people. I mean, I've been through some implicit bias trainings and there's no way that I could turn around and train on that. Like that stuff is intense, and so I want to make sure that the folks who are training are well trained and can understand the complexities of identity and race and how that plays out in life. And so, I think I just wanted to make that point there towards the end. I saw that. So thanks so much, Lieutenant.
Thank you. It looks like Chief Dominguez wanted to make a comment or two.
Mayor and Chief Dominguez, just one last thing I wanted to add. Attorney Vega Brown brought up the fitness for duty, and there is a psychological exam that's as part of a city policy, and that's what I was referring to when we bring in our psychiatrist to undergo that fitness for duty examination. But it does have to be a pretty severe issue that's going on for that to happen. But I just wanted to add that. Thank you.
So, Chief, thanks. Let me just ask you something, and I don't know if you're doing it right now, but I'm envisioning whether it's an email or a flyer that says something like, the heading could be, hey, you're feeling kind of, really stressed out, or you got something on your mind. The city offers this, and this for free, confidential, whatever, and send it out every 6 months or something to your officers. Does something like that happen, or is that even available? I mean, I know it's available, but does something like that even happen?
Mayor, actually it does. We have our employee assistance program. Bernie McCants is great. He's come to visit our officers as well, and he wants to partake into these yearly exams or interviews with our officers if it becomes available. But him and our Dr. DeBosto work together. They work hand in hand. He's been instrumental in helping several of our officers with some issues, but it does occur.
Okay, good. I just want to just share this with my colleagues. I think, and I always consider it a team effort, but years ago when I know I spearheaded the texting while driving, and what precipitated that was I saw a picture. This wasn't the real thing, but it was a picture of a person who was literally cut in half. He was texting. He wasn't paying attention. Flatbed of a trailer. He slammed into it and just severed him. And that was years ago. And that was just one picture. And although now it's kind of fuzzy, but I can still remember. I mean, they laid him out, and he's cut in half. And those are traumatic things that officers go through. Hopefully not that often, but I mean they do, and it's compounding all the various things that they go through is really difficult. And so I know I get a little defensive, but I as an employer, of my own business, I always try to, I would never have my employees do something that I wouldn't do. But then switching hats, like I've told you guys many times, I think I could probably only be a police officer one day. And then even then, I just wanted to be the guy writing all the speeding tickets. Other than that, I don't want anyone shooting at me. And I can't thank the men and women of the Las Cruces Police Department and the Las Cruces Fire Department the same. They see the same traumatic things, the fire department. I can't thank them enough for what they do. They put their lives on the line daily for us and keep our city safe. And first responders, even the ambulance. I know we don't have the ambulance service, but I just want to make that closing comment. Okay, so I think that's it. Correct, Damien? Jennifer?
Mayor, I believe that's it for me.
Okay.
Yes,
Jennifer?
that's it.
All right, well, I appreciate everybody, appreciate everyone's attention and presentation. And with that, I'll entertain a motion to adjourn.
So moved.
Second.
A motion made by Councilor Flores, second by Councilor Vasquez and Christine.
This is on the motion to adjourn the work session. Councilor Beta-Stuvi? Councilor Vasquez?
Yes.
Councilor Bencomo?
Yes.
Councilor Sorg?
He's gone.
Off. Councilor Flores?
Yes.
Councilor Gondara?
Yes.
Mayor?
Yes. Okay, well, good night, everybody. Be safe and have a happy Thanksgiving and try to celebrate it just with your family members, okay? All right, good night, everybody. 6:30.
Happy Thanksgiving to you. Thank you.